Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone, and best wishes to all of us. Your Excellency, Dr. Kiki Miradiah Wahyuni MARS, as the President Director of Pertamedica Indonesia Healthcare Corporation, respectable Dr. Harif Fadilah, SKP SHM MH, as the Chairman of Indonesian National Nurses Association, Honorable all trustees of Pertamedica Education Foundation, Honorable all supervisors of Pertamedica Education Foundation, Honorable all managements of Pertamedica Education Foundation, Honorable all directors of Partners Hospital of Stikes Pertamedica or representative, Honorable all director of Pertamedica IHC Business Unit and Pertamedica IHC subsidiaries or their representative, Honorable all deputy head of Stikes Pertamedica and the academic community of Stikes Pertamedica, and all participants of international webinar of 3 continents. First of all, let us praise to the Almighty Allah Subhanahu wa Ta'ala. Because of His blessing, we are able to attend to these 3 continents international webinar with TEP, Becoming Professional Health Worker. As we know, this event is a series of activities for the 34th anniversary of Stikes Pertamedica. Next, allow me, Rani Rahmasari Tanuwijaya, who will be the master of ceremony at this event, to greet our speaker today. Your Excellency, Prof. Datuk Dr. Hajah Bibi Florina binti Abdullah, as the speaker from Lincoln University, who will be represented by Mr. Tukimin Samsuito, Bachelor of Science Education, Bachelor of Science Nursing, Magister Public Health, Magister Science Nursing PhD, Ms. Erin Mary Lloyd, RN MHM, as the speaker from Technical Consultant of EMC Healthcare Group, Prof. Madya Dr. Haliza binti Abdul Rahman, as the speaker from University Putra Malaysia, Ms. Melissa Filipia, RN MHM, as the speaker from Phoenix Children's Hospital, Ms. Lori Works, MN, RN, CCRNK, CPEN, as the speaker from Clinical Education Specialist Pediatric in Intensive Care Unit, Phoenix Children's Hospital, Ms. Mary Calloway, MSNED, RNC, and ICU, as the speaker from Clinical Nurse Attending the Neonatal ICU, as the Phoenix Children's Hospital, Dr. Asep Saifuddin, SHMM, CHRP CHRA, as the speaker from CEO of Pertamedica Educational Foundation, and Mrs. Nurse Mariati Esos Eskepmars, as the speaker from Chairman of Stikes Pertamedica. I would like to thank our 8 speakers for their time and presence to present the seminar topic in this webinar. Before we begin the seminar, I'd like to take a few moments to explain the rules for today's seminar. Number 1, participants are welcome to rename in the format full name underscores the name of the institution. Number 2, after the speaker has finished delivering the topic, we will open the discussion session. Number 3, certificates will be given to participants who take part in the seminar for at least 5 hours. Ladies and gentlemen, for the next agenda, let's listen and sing in our hearts the national anthem Indonesia Raya and continue to the march of Indonesian National Nurses Association. All the webinar participants, please stand respectfully.
Nasional Indonesia, wujud ikatan profesi perawatan, tempat membina dan mengembangkan kemampuan diri dalam membuktikan keberadaannya. Menapaklah dengan keyakinan lebih pasti, sejajar dalam abdikan diri, bangkit berdiri dan langkahkan kakimu itu, menatap hari esok penuh asa. Wahai perawat Indonesia, bangkitlah dan majulah untuk menolong sekalian yang menderita. Kuatkanlah pribadimu, tingkatkan pengetahuan untuk memberikan asuhan keperawatan. Kita melangkah untuk mengisi pembangunan bangsa negara Indonesia, untuk mengantarkan bangsa menuju sehat semua dengan semangat jiwa Pancasila. Maju perawat, majulah dalam kancah pembangunan, tunjukkanlah pada sekalian orang. Jadilah perawat model kesehatan bangsa kita, jadilah teladan dalam hidup sehat. Bangkitlah perawat seluruh Indonesia dalam mengemban citra profesi, menjunjung tinggi kode etik keperawatan, laksanakan panggilan tugas mulia, mencapai derajat kesehatan seoptimal mungkin bagi warga negara Indonesia. Sebagai bukti kiprahnya mahkota putih suci dalam mendukung pembangunan kesehatan. Dengan organisasi PPNI yang kokoh, padu bersatu serta selaras, perawat Indonesia akan mampu angkat citranya di mata insan dunia.
Thank you. All the webinar participants are welcome to return to their former position. The next agenda, let's watch the company profile video, the vision and mission of Stikes Pertamedica, and the song of Mars Stikes Pertamedica.
Di tengah keadaan modern yang berkembang begitu pesat, terlintas asa dan mimpi. Akan seperti apa diri di masa mendatang? Akankah diri ini meraih karir impian, menjadi pribadi mandiri yang produktif, dan dapat mengabdikan diri untuk bangsa dan negara? Yang pasti, amanah cita luhur bangsa untuk menjadi sosok yang memiliki nilai profesionalisme, handal, peduli, dan tanggap dengan keadaan adalah sebuah nilai yang harus terus membumi dan menjadi bagian dari pemuda penerus bangsa Indonesia. Stikes Pertamedica senantiasa menjadi pemeran utama dalam dunia kesehatan dan keperawatan. Tidak hanya memberikan harapan dan mimpi, tetapi juga memberikan bukti nyata untuk mendorong terciptanya para perawat unggul yang modern, humanis, dan profesional. Dengan akses strategis yang berlokasi di Jakarta Selatan, Stikes Pertamedica hadir bersama masyarakat. Berdiri sejak tahun 1989 dengan nama awal Akademi Keperawatan Pertamina, berkembang menjadi Stikes Pertamedica, merupakan sekolah tinggi ilmu kesehatan unggulan yang berafiliasi di bawah naungan Yayasan Pendidikan Pertamedica dan PT Pertamedica IHC. Stikes Pertamedica hadir berkontribusi dan berkomitmen untuk mencetak tenaga kesehatan yang handal melalui program studi unggulan yang dimiliki seperti D3 Keperawatan, S1 Keperawatan, Profesi Nurse, S1 Gizi, dan D3 Teknik Radiodiagnostik dan Radioterapi. Sebagai sekolah tinggi ilmu kesehatan yang terakreditasi baik sekali dari LAM PTKes, Stikes Pertamedica memiliki sejumlah sarana prasarana yang digunakan untuk menunjang pembelajaran dan memberikan kesempatan bagi mahasiswa dan mahasiswi untuk bisa bereksplorasi, belajar mandiri, dan mengimplementasikan materi yang dipelajari. Di antaranya, mini hospital, ruang kelas, lapangan, aula, laboratorium CBT, perpustakaan, lab gizi, lab TRR, dan vertical garden. Stikes Pertamedika dilengkapi dengan lahan praktikum untuk praktik kerja yang terkoneksi langsung dengan Rumah Sakit Pusat Pertamina, Rumah Sakit Pertamedika IHC lainnya, lahan praktikum jiwa, dan lahan praktikum komunitas. Melalui suasana lingkungan yang hijau, modern, dan harmonis, Stikes Pertamedika berkomitmen untuk selalu memberikan pembelajaran yang holistik sehingga dapat membentuk tenaga kesehatan yang kompeten. Memberikan kebebasan untuk tetap menyalurkan bakat melalui ekskul seperti futsal, voli, taekwondo, saman, dan paduan suara. Stikes Pertamedika memiliki mitra kerjasama dengan RS Pusat Pertamina, RS Premier Group, RS Jantung dan Pembuluh Darah Harapan Kita, RS Dr. Suyoto, RS IMC Group, dan lain-lain. Sehingga memudahkan alumni kami untuk bekerja di dalam negeri maupun di luar negeri. Menjadi bukti, Stikes Pertamedika memiliki keunggulan kualitas dan siap menjadi tempat terbentuknya generasi penerus bangsa. Kini saatnya kamu yang ikut andil menjadi bagian terbaik dari generasi penerus bangsa yang memiliki jiwa profesionalisme, handal, peduli, dan tanggap dengan keadaan bersama. Stikes Pertamedika untuk kebaikan masa depan kesehatan Indonesia.
Dear ladies and gentlemen, let's start the seminar by praying to God, so the seminar will run successfully. Therefore, allow me to call Mr. Nurse Rian Agus Setiawan, Eskep Mkep, to lead the prayer.
Assalamualaikum warahmatullahi wabarakatuh. All webinar participants, before we start webinar today, let's pray together so that what we do today will get blessing. I will lead the prayer in a Muslim way. For those of other religions, it is hoped that they will adjust. Let's both raise our hand, bow our hearts and head. Bismillahirrahmanirrahim. Alhamdulillahi rabbil alamin. Hamdan syakirin, hamdan na'imin, hamdan yuwafi ni'amahu wa yukafi mazidah. Ya Rabbana lakal hamdu kama yanbaghi li jalali wajhikal karimi wa azimi sultanik. Allahumma salli wa sallim ala sayyidina Muhammad wa ala alihi wa sahbihi ajma'in. Rabbana hablana min azwajina wa zurriyatina qurrata a'yun waj'alna lil muttaqina imama. Rabbana zalamna anfusana wa ilang taghfir lana wa tarhamna lanakunanna minal khasirin. Allahumma inni as'aluka ilman nafi'an wa rizqan thayyiban wa amalan mutaqabbalan. Rabbi zidni ilman warzuqni fahma waj'alna minas solihin. Qulillahumma malikal mulki tu'til mulka man tasha wa tanzi'al mulki mimman tasha wa tu'idzu man tasha wa tudhillu man tasha biyadikal khair innaka ala kulli syai'in qadir. Tulijul layla fin nahar wa tulijun nahara fi lail wa tukhrijul hayya minal mayyit wa tukhrijul mayyita minal hayy wa tarzuqu man tasha'u bighairi hisab. Rabbana taqabbal minna innaka antas sami'ul alim wa tub alaina innaka antat tawwabur rahim. Rabbana atina fid dunya hasanah wa fil akhirati hasanah wa qina adzaban nar. Subhana rabbika rabbil izzati amma yasifun wa salamun alal mursalin walhamdulillahi rabbil alamin. Assalamualaikum warahmatullahi wabarakatuh.
If we only had 24 hours, would you spend the end of the world with me? I'll take my last breath, wrapped in your arms, yeah. If we only had 24 hours, would you spend the end of the world with me? Would you spend the end of the world with me?
Thank you to Mr. Nurse Rian Agustiawan Eskep MKep for lead us to pray. In the next agenda, allow me to invite our keynote speaker to deliver her speech. Ladies and gentlemen, please welcome Mrs. Dr. Gigi Miradiah Wahyuni MARS as the President Director of Pertamina Bina Medica IHC.
Good morning. Assalamualaikum warahmatullahi wabarakatuh. To all the distinguished speakers, Prof. Datu, Dr. Haja Bibi Florina binti Abdullah from Lincoln University, Miss Erin Mary Liot from Technical Consultant EMC Healthcare Group Australia, and all the speakers from Phoenix Children's Hospital, Miss Melissa Philippia, Miss Lori Wertz, Miss Mary Calloway, Dr. Asep Saifuddin from Pertamedica Educational Foundation atau STIKES Pertamedica, and also Ibu Mariati as a Chairman STIKES Pertamedica. And all the nursing webinar participants that I am proud of. As the advisor of STIKES Pertamedica IHC, I welcome this webinar to discuss the journey of becoming a healthcare professional abroad. We will explore important aspects such as the preparation required, challenges, and effective strategy to succeed this purpose. As we all know, STIKES Pertamedica was originally a nursing academy in 1989, then developed into Pertamedica IHC Health Science or STIKES Pertamedica in 2008. In this webinar, I will present overview about supply and demand nursing in Indonesia. Okay. So, based on data on life expectancy in 2023, there is an increase in life expectancy in various countries. With the increase in life expectancy in various populations, the need for health workers to provide health services will also increase. The health services needed by the community are not only hospitals, but also hospice, which is healthcare for end-stage patients. Based on data from the World Health Organization, the ratio of nurses to the entire population is at the level of 10 according to 10,000 compared to 10,000. Human resources for health workers have decreased abroad due to the mindset of people abroad, the decline in the birth rate, and the increasing number of people who are beyond productive age. With polemic like this, there is a lack of health workers who are ready to provide comprehensive health services to the community. Nurses are one of the pillar foundation professions in the delivery of health services to the community by providing comprehensive health services. Okay. Based on data from the Ministry of Health, based on data from the Ministry of Health, there are 1.26 million health workers in Indonesia as of January for 2023. Of that numbers, nurses are the most numerous health workers, namely about 500,000, with the total population of Indonesia in 2023 being 273 million. With this data, it is known that the average ratio of nurses in Indonesia is above the ratio standard from WHO. From diagram 1, we can find out that 66% of nurse graduates work in hospitals, 33% work in government primary healthcare, and while 4% work in other health facilities. From table 1, we can know that there is a surplus of nurses graduates starting from 2090 and then to the 2023, a surplus of 390,000 nurses is projected. From diagram 2, we can find out about the demand of graduate nurses abroad. 96.8% of nurses work in nursing home, and the others work in nursing assistant and nurse work in hospitals. The need for nurses is estimated that by 2023, Indonesia will have a surplus about 392,000 nurses. The absorption rate of nurses in the workforce in Indonesia for each graduate is only 20%. During the period 2015 to 2020, a total of 6,393 nurses were placed abroad as nurses care workers in elderly care institutions. As many as 780 nurses from Indonesia have filled the need for nurses in Germany in 2023. The government encouraged the utilization of nurses abroad to improve their skills and knowledge, as well as to develop a reintegration policy to encourage the empowerment to strengthen health service. Development plan for nurses includes Nurse Abroad program to improve nursing skills and competency that refer to the competency of international. Countries that have collaborated with Indonesia include Japan, Netherlands, Qatar, Saudi Arabia, Taiwan, Singapore, Germany, and also Malaysia. Career path for nurses, clinical instructor nurses, chief nurse, and nurse researchers should be deployed around Indonesia. According to Table 2, there are 6,393 Indonesian nurses working as professional nurses abroad, such as Taiwan, Japan, Saudi Arabia, Singapore, others. According to Table 3, there are 434 nurses, or about 6.78% of nurses who return to Indonesia after working abroad. So only 6% come back to Indonesia. But benefit of nurses working abroad return to Indonesia can bring back knowledge and skills to Indonesia and contribute to improving the quality of healthcare service in this country. By working abroad with high health standards, nurses can bring practice international standards in providing care, as well as bring a better work culture. So I hope that this webinar can be the first step to develop the quality of nursing in Indonesia and ready to go globally. Once again, congrats to Stikers Pertamedika and keep the spirit to become the best. Taufik wal Hidayah. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you to Mrs. Dr. Gigi Miradiah Wahyuni MRS as the keynote speaker for the speech. To Mrs. Dr. Gigi Miradiah Wahyuni MRS, we want to awarding the Certificate of Appreciation. To Mrs. Dr. Gigi Miradiah Wahyuni MRS, thank you again for your opening statements. Ladies and gentlemen, next agenda, we will show you a video to commemorate International Nurses Day. This video contains saying from our friend as a form of tribute for nurses. Please watch and enjoy it.
You can hold my hand, don't be afraid, you're not alone, though it seems that way. I know that time is ticking by, and you've been missing home, but you don't believe in miracles. Who knows what life brings? Things could be getting little heavy. It makes you feel weary, and time is slow. I can't control, but I promise you I'll give you mine. For some people, what makes one a hero is to save the world from evil masterminds. Though I'd love an invincible shield, it's enough to be patient and kind. I'm not super, but I promise I'll try. When you feel pain and the darkness settles, I'll brave the rain, fight through this battle, and I'll be here through thick and thin. You grow a little stronger, you feel a little better, and time is slow. I can't control, but I promise you I'll give you mine. For me,
Perawat adalah salah satu profesi yang luar biasa. Kami sangat mengagumi semangat menolong dan membantu orang lain, khususnya yang sedang sakit oleh para perawat, yang dilakukan dengan tulus dan ikhlas. Terima kasih kami atas pekerjaan yang sahabat-sahabat perawat lakukan selama ini. Kami berterima kasih dan sangat menghormati rekan-rekan perawat, dimanapun kalian berada. Kami juga bangga dengan para calon perawat yang dengan sungguh-sungguh belajar untuk menjadi perawat yang handal dan profesional. Selamat Hari Perawat Internasional.
Untuk perawat sedunia, saya mengucapkan selamat memperingati Hari Perawat Internasional. Tetap semangat dalam mengabdi dan bertugas demi wujudkan bangsa yang sehat.
Selamat Hari Perawat Internasional.
Perawat kami masa depan kami. Selamat Hari Perawat Internasional. Perawat kami masa depan kami. Selamat Hari Perawat Internasional. Perawat kami masa depan kami.
Selamat Hari Perawat Internasional. Perawat kami, masa depan kami.
Kami mengucapkan
Selamat Hari Perawat Internasional. Perawat kami masa depan kami.
Kami, dosen Sigit Pertamedika, mengucapkan selamat Hari Perawat Internasional.
Perawat kami masa depan kami.
Dari Prodi Gigi mengucapkan
Selamat Hari Perawat Internasional. Kami mengucapkan selamat Hari Perawat Internasional.
Selamat Hari Perawat Internasional. Perawat kami, masa depan kami.
Selamat Hari Perawat Internasional. Perawat kami, masa depan kami.
Kami, BEM Stikers Pertamedika mengucapkan Selamat Hari Perawat Internasional. Perawat kami, masa depan kami.
Selamat Hari Perawat Internasional. Perawat kami, masa depan kami. Selamat Hari Perawat Internasional. Perawat kami, masa depan kami.
I can promise that things will get better, but I promise for you I will try. Hope that's enough of a hero in your eyes.
Ladies and gentlemen, next allow me to invite the chairman of Indonesian National Nurses Association, Mr. Dr. Harif Fadilah, SKPS HM MH, to deliver her speech and open this seminar. To Mr. Dr. Harif Fadilah, SKPS HM MH, the time is yours.
Assalamualaikum warahmatullahi wabarakatuh. Ladies and gentlemen, good morning. Your Excellency Dr. Gigi Maria Dia Wahyuni Mars as keynote speakers and President Director of Pertamedica Indonesia Healthcare Corporation. Our colleagues, all of the speakers from other country, and so from Indonesian speaker, the Honorable, the Foundation of Pertamedica Education Institution, Director of Representation of Pertamedica IHC, and Director or representation of various hospital in partnership with Stikes Pertamedica, Chairman of Stikes Pertamedica, and all of staff, and as well as participants of this webinar international that comes from various countries. Ladies and gentlemen, on these extraordinary days, let me express my gratitude to all of the attendees for this willingness to participate and present in this webinar. We express our greatest gratitude to the Almighty God because we are in a healthy condition and be able to gather through the Zoom meeting. The Indonesian National Nurses Association is a professional organization formed as a forum that brings together nurses and functions as a unifier, coach, developer, and supervisor of nursing throughout Indonesia. In carrying out its function as a developer of the nursing profession, INNA has strong commitment to carry out various activities, including scientific activities such as training of trainers, workshops, and seminars at local, national, and international levels. This time, we full support to the 3-continent international webinar organized by Stikes Pertamedica with the topic Become Professional Health Worker Abroad. Pertamina Bina Medica Institute of the Health Science Stikes Pertamedica is an educational institution focused on improving the quality of human resources, the health sector. As we know, the Stikes Pertamedica was established in 2008, which is a development of the Pertamedica Nursing Academy since 1989, what the master ceremonial mentioned. Stikes Pertamedica have come so far and progressed rapidly through the years, especially during the pandemic, in improving the quality and competence of nursing graduates who are ready to work and bring change to society. Today, we gather to deepen on understanding of becoming a professional health worker abroad, which mainly concern nursing. We know that nurses are one of the most critical health professionals. In this seminar, nursing and management experts and practitioners from 3 continents and several countries will attend to share knowledge, experience, and the latest idea related to the health workers, especially in the nursing field. This seminar is the right platform for us to improve the quality of nursing as health workers by discussing the very good latest topic presented by competent speakers from various countries. I am sure that by attending this seminar, we will gain broader and deeper insight that can help us improve the performance and quality of the health services we provide to the community. Lastly, I thank the speakers, participants, and organizer who work hard to make this seminar successful. In particular, we would like to express our highest gratitude and appreciation to the Stikes Pertamedica, who has shown a strong determination to improve the quality and competence of nursing in Indonesia. Ladies and gentlemen, finally, I declare it a seminar open by let's together clap our hand 5 times. Welcome to join this international webinar. Hopefully, this event will run smoothly, provide significant benefit for all of us, and success. Thank you. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you to Mr. Dr. Harif Fadilah, SKPS HMKFMH, for delivering his speech and the opening of this webinar. Ladies and gentlemen, next we will begin the presentation of the topic, which will be divided into 3 sessions and will be held in panels in each session. For the first panel session, we invite our speakers to attend. Please welcome Your Excellency, Mr. Melissa Philippiak, RN, MHM, Mrs. Laurie Watts, MN, RN, CCRNK, CPEN, and Mrs. Mary Calloway, MSNED, RNC, and ICU, which will be guided by our moderator, Ms. Mika Mailan Eskep. Before the moderator take over the session, let me read the moderator CV. Is Mika Mailan. She lives at Jalan Dharma Putra Raya, Kebayoran Lama, South Jakarta. Her educational background is Kihua Primary School, Singapore, Christchurch Secondary School, Singapore, Millennia Institute, Singapore, and now she studied at Bachelor of Nursing, Stikes Peta Medica. Ladies and gentlemen, please welcome Mika Mailan.
Moderate. Oh, she's
All right, welcome. Hello, good morning to everyone, and thank you MCs for inviting me here also. Let me introduce myself first. I am Mika Mailan, a final year student at Stikes Peta Medica, and I'm very thankful to be given this chance to be the very first moderator for the day. Supposedly this session is supposed to be the last session, but if it's the last session, it's gonna be at 1 o'clock over at Phoenix, Arizona, America. So we shall be doing this for the very first session. Okay, let me introduce our speakers from the Neonatal and Pediatric Intensive Care Unit of Phoenix Children's Hospital, Miss Melissa Philippiak, Miss Lori Wirtz, and Miss Mary Calloway. First and foremost, I would like to read some brief background information on all our speakers. First, Miss Melissa Philippiak, RN, BSN, Phoenix Children's Hospital Extracorporeal Membrane Oxygenation and Primer in the Pediatric Intensive Care Unit. Miss Melissa used to study Bachelor's in Science Nursing at Arizona State University, and during her nursing career, she attained many qualifications such as a FON, Certified Bone Marrow Transplant. Second, we have Miss Lori Wirtz, MN, RN, CCRNK, CPEN, who is a Clinical Education Specialist, Pediatric Intensive Care Unit at Phoenix Children's Hospital. She took her Master's in Nursing Leadership at University of Phoenix and has been in the nursing industry since 1987. She has lots of experience and certifications from various community participation and special projects. And not only that, but she's also very well versed as a nurse from various roles that she has done and involvement in the professional organization. Lastly, we have Miss Mary Calloway, MSN, ED, RNC, and ICU, currently working as clinical nurse attending in the NICU at Phoenix Children's Hospital. Used to take her Master's of Science in Nursing at Grand Canyon University. She's very active in the education sector of nursing, where she has many instructor qualifications and has given many presentation, classes, and training. Right, before we begin today's presentation, let me tell you how this session will run. Firstly, we'll be listening to the presentation prepared by our beloved speakers for 30 minutes, followed by a discussion session of approximately 30 minutes. Participants can type questions in the link provided in the Zoom chat box. For presenters, there'll be 2 cues that I'll be giving, which is the 5-minute cue, which means presenter must finish up the presentation or answer questions, and the 1-minute cue where I'll be taking over the presentation. Finally, let's begin our very first session with the team from Phoenix Children's Hospital.
Hello. I'm going to share my screen first, but first I'd also like to say thank you. We're very honored to be invited to speak with you today. I'm Lori Wirtz.
I'm Melissa Filipiak.
And
I'm Mary Calloway.
All right.
We're here to present our talk on what does it take to work in Phoenix Children in the PICU and the neonatal ICU.
These are just some of our objectives. We wanted to discuss with you some regulatory requirements in the United States, the nursing licensure in the state of Arizona and for compact states. We wanted to talk a little bit about the certifications that nurses can obtain in the PEDS ICU and the neonatal intensive care, and discuss the education process for working in our units, and then kind of give you an idea of a day in the life of a nurse here at Phoenix Children's. This is a little bit about regulatory requirements. So nurses are required to meet certain standards, and these standards are set in the United States by CMS, which stands for the Center for Medicaid and Medicare Services. Our accrediting regulating bodies, DNV, which is a Norwegian company that does regular surveys and inspections of our hospital on a yearly basis. The Department of Health. We also are held accountable by federal requirements such as the Health Information Protection Act and the EMTALA, which is the Emergency Medical Treatment and Active Labor Act. And we are also held accountable by internal requirements such as corporate compliance. So let's talk a little bit about nursing licensure in the state. Mary?
So in the state of Arizona, to become licensed as a nurse, you must first attend a school that has been approved by the Arizona Board of Nursing, as well as our national boards of nursing. Arizona, we have a compact licensure that allows us to not only practice in Arizona, but to practice in multiple other states across the country.
So then we're going to talk about nursing certifications and organizations. And in the pediatric ICU, nurses are encouraged to become critical care registered nurses and sit for a CCRN, which is an examination, or become a certified pediatric nurse and sit for CPM. Mary, do you want to describe what neonatal nurses are?
So neonatal nurses have some similar certifications. We have the CCRN, specifically the neonatal portion. Most of our NICU nurses tend to go for the RNC-NIC, which is registered nurse certified in NICU, but it can also be in lower level neonatal nurseries, as well as women's health services.
You know, I'd like to point out that a lot of these certifications are independent of what nurses obtain in nursing school, and they're oftentimes pursued by nurses who have at least a few years to sometimes many years of experience under their belt, showing their dedication to their craft.
It's a great testament to the profession of nursing to hold additional certifications. We highly encourage it, and there's a lot of doors that open up when you have national certifications. So it's something that I encourage all nurses to do, no matter what country you live in.
But then there's also professional organizations that we are able to follow. There's the American Academy of Pediatrics, the American Association of Critical Care Nurses, the National Association of Neonatal Nurses, the Academy of Neonatal Nurses, and the Association of Women's Health, Obstetrics, and Neonatal Nursing. Nurses are encouraged to follow these organizations. They publish journal articles that often guide best practice at the bedside and allow us to see what other areas of the country are doing.
And it helps us set the standards. It's heavily influenced by evidence-based practice, and it's a good show of support for the nursing profession. There is another group that I'd like Mary to talk to you about that is also highly encouraged for hospitals to join.
So Solutions for Patient Safety actually stemmed from two very large children's hospital systems. Actually, they were in Ohio, and they found that their standard of practice actually led to patient harm when they did a serious safety event review. So instead of that hospital just keeping it to themselves, they decided to share it with their competitor, because they felt that, yes, we can compete for patients, but we should never do it at the risk of harming a patient. So now Solutions for Patient Safety is actually international. I know we definitely have some in Canada. We may have one in Mexico. That's actually why we're not all in the same room together, because I'm actually in St. Louis right now, getting ready to present at Solutions for Patient Safety and share with others different things that we're doing to keep our patients safe, and collaborating across a large network of children's hospitals so that we can all provide the best care. Even though we're competing, we're still providing the best care possible.
And we find that when we all rely on each other, whether it's within the United States or it is within the world, that when we're sharing our evidence or our outcomes, that we're actually doing so much better for our pediatric patients throughout the world.
Nursing is a team sport. We must all work together and be a team to really make sure that we have the best outcomes for all of our patients.
Here at Phoenix Children's, we actually have a 18-month residency program. We also developed a very special program in collaboration with Arizona State University. It was one of the first of its kind in the nation. It is actually, nurses are able to get a baccalaureate in pediatric nursing. So through the Arizona State University, our nurses will, the student nurses will come to our campus here at Phoenix Children's. They do all of their clinical education, all of their simulation education here on our campus, and they graduate with the 4-year degree in pediatric nursing, which is very, very exciting, because currently most regular nursing programs have very small amount of pediatrics. It's heavily adult, so we felt the need to really specialize, because kids are not just little people. They have very special needs, and it takes special people to care for them. So we also developed an 18-month residency program that really concentrates on building well-rounded nurses. And it uses a lot of the standards that our professional organizations that we just spoke about highly recommend. Nurses who are in the residency program in the intensive care track will receive 45 shifts of orientation. And at the end of their 18-month residency, they will be expected to sit for a national certification like the CCRN or the CPN or the RNC for the neonatal intensive care unit. So we're very excited about this, and just want to share that with you, and always happy to share if people have additional questions about this program. It's just I think it's just a great sign of excellence.
The other
Let's
piece
talk-
to the other piece to that residency program is we think of nursing and learning in the classroom setting, but that first year, year and a half of nursing, you are continuing to learn and grow and understand the organization that you're working in. So there is no point along the realm of nursing that we ever stop learning. So it is very important to make sure that we not only have good schools in place, it also is important to make sure that the hospitals have a good way of growing those nurses and making sure that they have that ability to provide that safe care in the most critical time of their nursing career.
So we're going to move on to a day in the life of a nurse at Phoenix Children's. We'll talk about a few things that are similar between the pediatric ICU and neonatal ICU, and then some pretty stark differences. So moving forward, this is an image of what we use as our communication tool for nursing shift report, specifically in the PICU, the PEDS ICU. All of the information on the front goes over the patient's weight, patient's age, what brought the patient to us, and what's changed since they've come to us. And then it breaks down the patient's specific needs by system, starting with neuro, then moving on to respiratory, cardiac, GIGU, skin, addressing any medications that they're on and drips that they're running. And then the back side of this sheet is something that's kind of living and breathing with the nurse at the bedside. It's used as a grid form to document any type of input information, so temperatures or pressures, output information that he or she is obtaining at the bedside, medications that are scheduled. But also, when you're bringing this sheet into your room with you, let's say your patient's hour didn't go according to plan. It also gives the nurse a place to organize their thoughts and later document those things, whether it's medication, whether it's an event that occurred at the bedside, whether it was a complete change of care. There's safety parameters on the side, and then at the very bottom, the nurse is encouraged to document anything that changes from rounds when the physicians round on the patient, any order changes throughout the day, or any concerns.
It's very holds up consistency so that nurses, when they're handing over from shift to shift, aren't losing critical pieces of information, and that they are, again, passing on the most pertinent information and, again, evidence-based information that shows good outcomes for patients.
And while each unit has their own individualized report sheet, they do follow an SBAR communication style. Lori, would you like to speak on what that means?
So SBAR stands for a way that you can formalize your thoughts when you're communicating. S is for the situation, what is actually going on with the patient at the time. B is for background, so any history. A is for your assessment, and then R is for recommendations. So what you would recommend on behalf of this patient. So it is also an evidence-based communication tool that helps with consistency, and hopefully we don't lose critical pieces of information when we hand patients over from one nurse to the next, because we have seen that that is a great time for errors to happen. So we want to, again, maintain consistency.
Yeah, and this document has evolved in all the years that I've been here. This is just the most current form, and things that we found more pertinent over the years are what we've added to it.
So you may notice that this looks very similar to the PICU SBAR. All of our ICUs actually have the exact same flow. What we need from it is just a little bit different. The PICU doesn't necessarily care about exact date of birth, what their gestational age is, what they're corrected, what they looked like when they were first born. But I need to know that for all of my patients so that I know where they started, so that I can see how far they've come. But again, it looks very similar in every one of our ICUs. It's very interesting. We tend to share with each other so that we can pull from each other and design these, because again, nursing is a team sport.
I think it's also important to notice that on the bottom of the neonatal ICU sheet, there's a discharge pathway, because oftentimes their babies are growing to go home, and our children are oftentimes going to a lower level of care. We don't very frequently discharge from the pediatric ICU.
Once we've given report from one nurse to the next, it's very important that we then, each nurse, the offgoing and the oncoming nurse, go to the bedside and do safety checks. And again, this is something that we teach, that we want to make sure nurses aren't skipping the steps on this. We want to make sure that nurses go in, and we have these pre-printed weight-based code sheets already made. We post that in the room, so it's very easy to see in the event that a patient does arrest. We won't have to pull out our calculators. We already know what doses we would need to be giving for epinephrine and those primarily, those primary code drugs. We always ensure there's a bag and mask, oxygen suction, our alarm limits are set, we trace all of our IV lines. We make sure our whiteboards, our care boards are up to date with information for the families. Then both nurses will review orders and look at our electronic medication administration record. And we also adopted a communication framework at Phoenix Children's. It's called AIDET, A-I-D-E-T. It stands for Acknowledge, Introduce, Duration, Explain, and Thank You. And we find that that is a very good way to walk in when you're meeting a family for the first time. We're not telling nurses what to say. We want to give them a framework. And so AIDET works very well. Go in, say hello, introduce yourself, let them know that you're a nurse. What are you doing? How long will it take? And then thank people when appropriate. And we think the most important thing of all of this is acknowledging people and saying hello really reduces a lot of anxiety for our families. Because for us, today it is Wednesday for most of everybody here, but for many of our patients here in the ICU right now, it is the worst day of their life. So the last thing we need to do is cause any more trauma for them. And just going in and a friendly smile and saying hello really helps a lot.
Yeah. Should we give an example of what an AIDET sounds like? So oftentimes when I walk in a room, I greet the family. Hi, my name is Mel, and I'm going to be your nurse today. I'm taking care of your child. I'll be here until this time tonight. My plan is to come back in maybe 30 minutes and start my assessment. Is there anything that you need me to bring in the meantime? I'm happy to help with that. Thanks so much. And then you leave the room. When you come back, you may find a new face in the room and you get to do it all over again.
Example.
All right, so we're going to talk about similarities between the PICU and the NICU. Both units do a head-to-toe assessment, especially at the beginning of their shift. We both do PIV, so peripheral IV checks, and buddy checks. Where buddy checks, there's an independent assessment. Another nurse is responsible for coming in twice a shift and looking at an infusing peripheral IV to make sure that they agree with what the patient's nurse sees in that. They're comparing the size of both extremities, the softness, and making sure that there's no infiltration or extravasation on that affected extremity. We're also doing a skin assessment partnered with our Braden QD. Laura, would you like to explain what the Braden QD is?
The Braden QD is an evidence-based tool that was developed by Dr. Martha Curley, who's a nurse from Children's Hospital of Philadelphia. And it is a tool that helps look at all of the things that are going on with the patient and then gives us a score. Are they a high risk or a moderate or a low risk for pressure injury and skin breakdown? So also looks at devices that we have on the patient, because we do see a lot of skin breakdown from things on the patient's skin, maybe an endotracheal tube rubbing in the corner of the mouth or an NG tube rubbing in the nair. So we take into account the devices, and then that will add to the score. So it is a very useful tool when we're assessing skin. We also do our initial skin assessments with 2 nurses to verify that we're not missing anything. So,
And on that tool, Lori, it's usually the higher the score, the more complications or skin potential breakdown that this patient could have. Mary, would you like to explain how our hygiene cares and our hospital acquired conditions bundles pair together?
So our hygiene cares, we want to make sure that our patients are kept clean because those are the items that actually help prevent infection. So we make sure that we do oral care. If they are intubated, we will do oral care at a minimum of every 4 hours. The big difference between the PICU and the NICU when it comes to oral care is we use mom's own breast milk for oral care in the NICU, whereas in the pediatric ICU, they have oral care cleaning kits. We want to make sure that we do linen changes because our babies and our big people as well all live in their beds quite a bit. They get out every once in a while, but they do spend a majority of the time in the bed. So we want to make sure that the area that they're in contact with is clean. We want to make sure that we keep all of the areas clean, including the perineal area, especially if they have a urinary catheter in place. And then we do CHG cloth bathing to help make sure that we are putting something on the skin that continuously assists in decreasing the ability for those bad bacteria to grow. So we get a lot of these items from the Solutions for Patient Safety hospital acquired conditions bundles. Many of those are unplanned, we utilize these for like unplanned extubations, how to keep our patients intubated and not accidentally extubated, how to keep them safe from catheter-associated urinary tract infections like pericare, how to protect them from central line associated bloodstream infections. That's that CHG cloth bathing, those linen changes, the oral care, the buddy checks for those peripheral IV infiltrations and extravasations. The earlier you catch them, the less damage they can cause. Pressure injury, using that Braden QD to find those that are at the highest risk, and then implementing solutions that will help decrease that risk. Ventilator-associated events, it used to be called ventilator-associated pneumonia, making sure, again, oral care, linen changes, keeping them clean to help decrease that risk of them getting an infection in their lungs. Fall prevention, making sure that if they can get up, they do. And if they can't get up on their own, we know exactly what the plan is. Decreasing surgical site infection. Again, it's that whole list on that left-hand side. And then making sure that we're providing safe and appropriate medication administration, making sure that we know all of the rights of medication administration.
So also in the PICU, once a shift, we're looking at our EEGs. Oftentimes the leads that are placed on the scalp can cause some skin area of injury, redness, and breakdown. So we're assessing at least the frontal 4. We're looking at any trachs that we have, G-tubes, NGs to make sure that those stomas or orifices don't show any signs of compromise. We're doing our Foley cares with our pericare to also make sure that there's no sign of infection or compromise. And then we're assessing any temperature probes to make sure if they're still needed, that they're safe for the patient to maintain.
I think the big difference between the PICU and the NICU in that regard is for the EEGs. The PICU is very good at assessing those frontal leads. Well, in the NICU, our kids have really big heads and the back of their head is planted on something. So we also need to make sure that we are checking the back 4 leads because those are areas that the NICU finds are the highest risk for EEG skin breakdown.
Mary, what do you think influences the occipital region more on the neonates versus on the pediatric?
Because they have a big head and it sticks out a lot in the back, which
That's
is part
fair.
of the reason that when we're talking about trachs, we want to make sure that, especially in the NICU, we have a neck roll in our trach to go bag because that head will fall forward every single time when you're trying to do trach care.
So we're going to talk about a few things that are just PICU specific. So in the PICU, we do very frequent assessments. Oftentimes they're every hour but our baseline is every 2 hours. It doesn't matter if your patient is an infant or a late teenager. It's dependent on what brought them to us and what their specific needs are. We're also doing a full head to toe skin assessment with 2 nurses. On an infant, that's not necessarily a challenge, but on a 17-year-old patient, that can require more than just 2 nurses to complete that task. We're also looking at device location assessment with 2 nurses, blood pressure cuffs, Foley anchors, chest tubes, pulse oxes, where our leads are. Any of those things can drastically influence a patient's skin integrity during their stay. And then lastly, we're looking at shift assessments for our C-collar on our trauma patients and doing our delirium screen at noon and at midnight. Delirium in the ICU can be atrocious to deal with. And I'm going to let Lori talk a little bit about what we do to manage that.
We do a lot of non-pharmacological interventions to reduce the risk of delirium by promoting day-night cycles, quiet environment. We actually have decimal meters in our unit. So if we're getting too loud, lights will change different colors to let us kind of remind us to not be so noisy. We really try to avoid the use of benzodiazepine or anticholinergic, like Benadryl, limit those types of drugs because those have a high prevalence related to delirium. We try to limit the use of restraints. We try to keep our patients frequently oriented, and a big part of that is having family presence. We allow our families to be here 24 hours a day. It's important to have not only familiar objects, but to have familiar voices and family with the children. We highly encourage early mobilization, and we get children up on with ET tubes in, maybe standing or sitting on the edge of the bed. And we also have small infants up in mom's arms with endotracheal tubes. We've even gotten children up on ECMO with multiple team members where we have them stand next to the side of the bed.
Or sit in a chair.
Or sit in a chair. Mm-hmm. We try to get lines and tubes out as soon as we can. Limit the TV and screen time, because we know that TV and screen time really help kind of reduces the amount of melatonin that your brain will produce. It takes about an hour once you turn off a screen for your brain to start to build up enough melatonin to rest. And delirium is just really caused by the lack of REM sleep. And delirium can lead to permanent cognitive disabilities in children. And so we really try very hard not to let them develop delirium whenever possible. So those are some of the non-pharmacological. We also can do things like melatonin. If a patient has a psychotic type of delirium, we'll add risperidone or Haldol as well.
So every 2 hours, we are repositioning our patients. They usually coincide with our assessment that's being done. We're making sure that we're offloading any areas of skin that have been in contact with the mattress and trying to get them off of those to reduce harm. We're doing early mobility. So if our patient is unable to ambulate or get out of bed or get into mom or dad's arms, we're also integrating PT and OT, range of motion, stretching in those instances to try and keep our patients from building up edema in their extremities, but also keeping their joints active. We promote sleep hygiene. So during day shift, we have a 2-hour quiet period. And on night shift, we have a 4-hour quiet period that also helps reduce our delirium.
And then we do nurse-led rounds in our PEDS ICU, where the physicians won't even start rounding on the patients until the nurse is present. And the nurse will start off the rounds, introduce the patient, and then they'll go through our PICU Strong bundle, which I will explain to you. So we adopted something called ICU Liberation, developed by the Society of Critical Care Medicine. It is actually a bundle of care that was developed in adult critical care to reduce the risk of intensive care syndrome. And so that's really what trickled down into the pediatric world. And so we've adopted the bundle of care, but we, instead of calling it ICU Liberation, we call our initiative PICU Strong. STRONG stands for that our patients are survivors, they're thriving, they're resilient, they're optimistic, they're nurtured, and we're all going that extra mile. And so here's an example of our nursing Cardex, which has this bundle element. It is the A through F bundle. And so it's we're looking at preventing pain, getting people off ventilators as soon as we can, making sure we're giving them the right types of drugs. We're assessing for delirium every 12 hours. We're heavily active with early mobility. Our families are engaged. And again, trying to get all those lines and tubes out as soon as we can. Evidence has shown that if you implement 100% of this bundle elements into an intensive care syndrome, you actually start to see decreased length of stay, decreased days on ventilators, decreased risk of delirium. So it's been pretty exciting that we've adopted that into our peak ICU.
Is responsible for helping fill this out. Day shift is responsible for presenting this in the rounds for the day. So we also have some PICU specific resources, most of which are located on our intranet. We have a resource folder. We also have badge cards that are kind of a quick tool that nurses are able to keep with them for any period of time. We also have clinical skills from Elsevier, a PICU newsletter that Lori curates. We have CLNAs, which Mary, I'll let you talk about what your role is.
So the clinical nurse attending, our job is to look at each of the most critical patients in the unit and make sure that there is nothing slipping through the cracks, that I'm monitoring trends. I'm not just looking at today, I am looking at the last week. Where have they been? Where are they at now? Where do we think they're going? So that we can catch things before they get out of hand. Catching sepsis early lets us start treating before they start going down the sequelae that leads to a code event during sepsis. So anything that we can do to catch those early and then help the nurse advocate, because we know that communication between the multidisciplinary team is the most important piece of any form of nursing and making sure that our patients are safe, which is why most of SPS stuff has to do with nursing communication. And teaching those nurses ways to actually speak to what is going on with their patient.
I think that's amazing. I also think that it's nice to have somebody more familiar than a CERN. A CERN is a nurse on the unit who goes around trying to help educate kind of on the spot and grow individuals on a shift by shift basis, versus Mary's role is a permanent role and she's shift specific. And then we also do mock codes, not just for our nurses, but also for our physicians. We're a teaching hospital. So while we have residents and fellows and physicians, we have nurses who are on this multiple areas of their learning and in their growing, so that they can become familiar with the roles of what a code is and what a code is supposed to look like before it actually happens on the unit.
And if you didn't know, CERN stands for Clinical Education Resource Nurse.
Lordy.
This is just an example of also the picture is an escalation algorithm. We want to make sure that everyone feels safe to speak up on behalf of that patient, that every question they ask on behalf of a patient is a good question. And if they feel like they're not being heard, we always want to make sure people know how to escalate up the chain so that our patients are safe. All right,
Mary. Now you get to tell us what is NICU specific.
Okay, let's look at some of the NICU things. First of all, we don't touch our patients every 2 hours if we absolutely do not have to. We tend to do our hands-on assessments every 3 to 4 hours based on their feeding schedule. However, we have a non-STEM assessment that allows us to look at our patients and decide, do we need to do hands-on or are they looking like they are safe? Patients are critical, needing assessment and need active sleep without disturbance. When babies' jobs are to sleep, they're supposed to sleep most of the day. Every time we touch them, we pull them out of good sleep and good healing time. So we are very, very interested in exactly how do we bring them out of that sleep time, as well as how frequently do we bring them out of that sleep time. We have a developmental therapy team that also looks at their milestones. Any baby that is in a NICU is going to have some decreased or some delayed milestones. So we want to make sure that we stay on top of that and are able to give them the best possible outcome that we can, because it's not just about keeping them alive, it's about giving them a life to live. So our interventions are set around those feeding times. We cluster our cares. If the head ultrasound is supposed to happen today, then I will set up an appointment with them for one of the care times. If they have a head ultrasound and they have an echo to look at their heart, and they also need an EKG, I am going to say, okay, we can do one of those at a time. Which one is going to change our care the quickest? Because again, the more I'm touching them, the less they're healing. The more I'm touching them, the less that they are growing and developing a normal brain. So we do have that decision tree on, do we need it now or can it wait? When it comes to CHG cloth bathing and different chemicals and emollients, we have to be very careful in the neonatal ICU. We have patients whose skin is similar to that of a fresh burn victim. You are not going to put chemicals, you are not going to put rough cloths on a burn victim's skin. So don't do it to the preemies especially. So we have to be very careful because things cross that skin barrier very rapidly in the neonatal population. So for the first 2 weeks in all of our babies, we have to be especially careful, and we don't use any form of chemical or emollient on them. CHG cloth bathing is very, very specific to what their gestational age is. And we have isolettes that provide humidification because babies are supposed to be in preemies are supposed to still be living inside their mom, which is a very moist environment. So we create that environment by giving humidification so that their skin can naturally keratinize as they age. Some other things that we have that are NICU specific for advocating and escalating, not only do we do nurse-led rounds, we don't have the PICU strong. We actually completely present our patients to the medical team and are a part of all of the decision-making on our patients just using our SBAR report sheet. However, we also have a hands-free system that allows us to call for assistance from our doctors, our social workers, and anybody else on that medical or multidisciplinary team. So the question becomes, when do you use the Vocera? Because we can do Vocera texting. When do you actually call? When do you hit the buttons on the wall? Because we want to make sure that we are making the best decision. And so we have a NICU clinical concern algorithm that allows us to explain to the nurses, okay, if you're slightly concerned or it's your first time being moderately concerned, why not get your CS and CLNA in there? Because a second set of eyes may be able to help you determine what's going on, all the way up to now we're calling a level 2 huddle because we don't feel like we're being heard. And we need to make sure that somebody has got eyes on this patient, all the way up to I'm extremely concerned, I'm going to hit the code button on the wall. So we have those in place to help make those decisions, because the more tools that you give somebody, the more likely they are to be successful. Slide. So the other thing that we have is we also have a NICU newsletter that is actually put together by our AA, our administrative assistant for the unit. However, we create huddle items based off of things that are coming up and in the moment so that we can do education. And we do that in our huddles when we're meeting with the nurses and giving out assignments. So at the end of every month, when the NICU newsletter goes out, all of those huddle items are also attached to it so that we can see exactly what we've been working on all that month. We also have a clinical nurse attending. And we have the CERN role. We also have something called the NICU Education Series, and you'll see here all of our team working together in a mock code. Dr. Tom bent over intubating our doll. We actually do quarterly education where every nurse does a mock event or mock code every quarter. We also do education. So as a CLNA, my job is to monitor trends. So I bring the trends to the educator, who used to be me, but still me right now until we get one. And because we always are looking for education specialists. But we actually bring those trends and look at what is the most critical thing that needs to be taught in the unit and what is the best hands-on way to teach it. And we do those in our NICU Education Series.
Oh, yes, we made it. So that's a little bit about what it takes to be a nurse here at Phoenix Children's in the Pediatric Intensive Care Unit or the Neonatal Intensive Care Unit. We have a short little video we'd like to play for you as well. And I'm going to hope that this works. All right, so let me get this started. So. One second here.
Can it be shared, Miss Lori?
Yes, let me, I'm going to see if I can get it to share. So, oops. 1 second here. Let me stop sharing this and let me try to share again on here. Okay, and
Hi, Miss Lori. I think the sound hasn't been shared yet. Share sound. I think you need to tick that. I can't hear anything. Yeah.
Let's see here. No. Share sounds.
Share that screen and share.
Hang on. Where's share sounds? New share.
So you hit stop share screen first. Then after
Yes.
that, yeah, and then you
Sorry.
again, but then there'll be an option below on the left hand side where you can click for the sound. If I'm not wrong.
Okay, 1 second. Oops. Okay. I will restart this and well, if I cannot get the sound to share with you, let's see.
You can send it over first, and we will share it on our screen instead. Yeah.
Send. We're gonna do that.
Lori, if you put the link in the chat box, then they'll be able to click it from the chat box.
Yeah, that's also the
Okay.
Yep, and then go into the chat and click, paste, and send.
Okay.
There we go.
There, I sent it to you, so you'll have better luck. Sorry, I don't know why. It's
okay. It's okay. We'll try our best to.
okay.
Thank you so much.
Thank you. Sorry.
So we'll be watching a video from Phoenix Children's Hospital. There'll be share screen now.
Since opening its doors in 1983, Phoenix Children's has recognized that the heart of its mission is a passion for care. For more than 35 years, nurses at Phoenix Children's have been on the front lines and at the bedside, providing Arizona's children and families hope and healing. And while the staff at Phoenix Children's has provided award-winning care to patients, Phoenix Children's also provides award-winning care to its staff.
Working at Phoenix Children's Hospital, it's a great environment. You feel supported. I think starting out with the principle of doing what's best for children and their families is what sets off the tone.
Leadership backs you up in any way. If you have any questions, any concerns, I feel like this organization has our back.
I have the same feelings when I first started in orientation 7 years ago to every day I walk into the doors today. It just makes you love what you do.
I'm honestly honored to be able to work here. I've actually been able to take my education further. I was able to get my bachelor's degree paid for by Phoenix Children's Hospital, and then 2 years later I went and got my master's degree paid for by Phoenix Children's Hospital, so that's supportive.
We all work so closely together that we trust each other. There's a mutual respect of trust in every single thing that we do. What I love is that you can learn different departments, different areas. You can advance in so many ways. I've grown so much since I started here 10 years ago.
What I love about living in Arizona, Phoenix in particular, is how centrally located it is. You have skiing within 2 hours away in Flagstaff. You have the ocean in Mexico or to our west in California. Not to mention, we have the Diamondbacks, the Phoenix Suns, the Coyotes, Arizona Cardinals, all of which are invested in Phoenix Children's Hospital.
My husband and I are avid golfers, and we just love golfing in the valley. There's always something to do outside.
Camping, just if you love the outdoors, there's so much here.
Oh my gosh, what is not to love about Arizona? Our sunsets, our climate, our lakes, Sedona, Phoenix Children's Hospital.
Bottom line, Phoenix Children's is like no other. We're one big family. We work as a team. We are hard workers. I feel like I have more here than I've ever had in a facility to do my job and to do it well.
When you have people that don't leave, there's a reason.
It's a great feeling, and I love working at Phoenix Children's Hospital.
We strive for excellence. It shows in the people that work here, in the care that we provide. I wouldn't be here that long or to extend longer if I didn't believe that. And I'm so grateful, and we're blessed to be here because this hospital is amazing.
I was meant to do this job. Phoenix Children is that vessel for me, and they meet everything that I've ever wanted to do for a child.
Be prepared to love what you do.
I love working for Phoenix Children's. This is the place to be.
Those who are passionate about care and want to make a difference will always find a home at Phoenix Children's.
Thank you.
We just want to say thank you so much. It's been such an honor to be invited to be here.
I think that video also talked about how teamwork makes the dream work. And I think that conferences like this that allow us all to come together, not just within our own countries, but internationally, it really does allow us to learn and grow together so that all of our nurses everywhere can provide the best care for all of our patients.
Actually, I would like to thank you. What time is it there? Yeah, I'm just asking.
It's 7:45 at night here in Arizona. Mary, what time is it by you?
It's 9:45 p.m. here.
9:45 here, so it's in the morning here and at night there. So
It's still May 9th here.
Yeah, you actually like spend some time and take your time to like share this with us. So we are very thankful for that. So we learned a lot today about Phoenix Children's Hospital and what are the differences between NICU and PICU, and what are some of the qualification needed also. So can we move on to the next discussion? Would that be okay? Okay, let's have the first question. All right, it's from one of the students in Stikas Pertamedica. She asked, how do we become professional health worker? She asked like, how is it step by step, maybe from what you said earlier on, like the studying point of view, then followed by the qualifications needed. Yeah, what are the steps to becoming a professional health worker?
I think the first step is attending a university, and I highly encourage nurses to obtain a minimum of a baccalaureate in nursing. And then here in America, we have a great nursing shortage. We were listening to your first presenter who said you had a nursing excess, which was quite shocking to us. But nurses here, once they graduate an accredited program, here at Phoenix Children's, we look for baccalaureate prepared nurses. I think a lot of hospitals in the country here are doing that. And then applying for a position. And then they need to go to their the state board of nursing for whatever state they live in. And there is an exam they have to pass in order to obtain a nursing license. And then they can be offered employment at almost any hospital they pick.
So you start training as a nurse if you have no experience and you're fresh out of nursing school. If you have experience as a nurse, then that nursing board is going to license you in the state you choose to work, and you do a modified type of orientation. It's not necessarily as exhaustive as someone who's never worked before. The goal is that once you're working as an independent nurse on the unit, that then you move towards some of those other certifications that we've talked about. And you would be able to choose from that list of certifications based on what your preference is, but also what your institution recommends or supports, what you would actually use and be useful in your daily nursing career.
The other item to think about is for our international nurses coming to the United States. Most of the boards of nursing are able to take a look at the content from the nursing school that you attended and are able to ensure that it meets the standards of the for being able to sit for the NCLEX, which is the test that we take here in the United States that certifies us as a registered nurse. And then once you are able to do that, then definitely looking within the United States for a position.
I see. Okay. So we, first of all, let me summarize what has been answered by our speakers. First of all, we need to study first in a school, take the bachelor's in nursing, and that's the best, right? Rather than taking a diploma, right? Okay. Then followed by sitting for a nursing board exam. Over in America, it's called NCLEX, am I right? And then after that, if beforehand we already have like certain qualifications or certain certs, we can actually choose where to head on to. Okay, cool. I hope that Irmawati, I hope that answers your question. Let's move on to the second question. So it's by Evelyn Alicia, one of our students. She asked, do we need an international nurse certificate to become nursing staff? For example, in the Phoenix Children's Hospital, do we need the international nurse certificate, and how do we get it?
I am not 100% sure how to answer that question. We've hired nurses from other countries here at Phoenix Children's, and I know most of our human resources department typically helps nurses navigate that process. I know that, again, they have their current education has to meet the standards of the Board of Nursing, and they would have to take the NCLEX exam here in the United States. And I believe they also need a work visa. But typically our human resources department has navigated that for us. And we have several nurses who started from, we had nurses from New Zealand and Indonesia and India and the Philippines and Great Britain, and many of them still work here, and that's been years and years since they started.
So in looking into it, yes, you will go through a commission on graduates of foreign nursing schools, which is the most common organization for different states, and they will look at your licensure within your country and see if it's like for like, or if there are any further pieces of education that you will need to be able to sit for the NCLEX, also known as the Nursing Certification Licensure Examination, blah, blah, blah. That's a lot of things, which is why we call it the NCLEX. And at that point, you would be able to choose what state it is that you are wanting to go to as the regulatory body and sit for the NCLEX and then do the board certification within that state.
Right, let me summarize that. I think to answer this question is that first of all, we need to know whether the Indonesian licensing and the American licensing is whether it's accepted first of all, right?
Yes.
So maybe the person who asked this question, you'll need a lot of research, definitely a lot of research, definitely also need to study, because even though you have the licensing in your own country, but you also need to adjust to the license that is needed in the country, in the outside your country. Yeah. Let's move on to the third question. Okay. Andromeda asks, what special competencies must be possessed to become a nurse in the ICU or PICU room?
So it takes a very detail-oriented individual to be able to work on these units. Somebody who handles stress well and is good at critical thinking, but also is very compassionate, an excellent communicator. And some of those skills can be learned over time. I think that we wouldn't have stayed in this career if we didn't grow in those skills. I've been here for 17 years. Lori, how long have you been here?
Oh, I started here 36 years ago.
Mary, how long have you been here?
15.
And I can say that when I started, I didn't have as many of those skills. I was very detail oriented, and I had a lot of optimism and excitement towards the career. I loved children, and I learned all of those other things along the way.
Okay.
I will say the initial needs are that you pass the NCLEX. We do not have any extra certifications for you to get started. Certification comes after, I know for the CPN, Certified Pediatric Nurse, they can take it day one. For the CCRN, you have to have at least 12 months of work to meet the hour requirements. And for the RNC, NIC, it requires a minimum of 2 years within the NICU to actually get your certification, because the certifications are saying that you are an expert in that field. So to start, you just need to be a nurse and have your nursing license here.
And in order to reach the point where you are proficient and considered a great resource, you typically have to have 5 or more years in the PEDS ICU or the neonatal intensive care unit. It is a very, very complex places to work. So it's a long learning curve.
We still have a long way to go. Okay. Yeah. First of all, we definitely need to be a nurse first, then followed by the other certifications in order for one to be actually employed in the PICU or NICU. And of course, we also need various skills and also based on experience, I guess, right? Because the more experience you get, the more you understand how things works and how to do it better. All right, let's move on to the next question. Hold on, let me read this first. Okay. Questions from Julia Indriati. She asked, is it possible that you can be invited to Indonesia to help hospitals that will develop PICU or NICU? Or can we do a comparative study to your hospital with the aim of improving the ability of our nurses? And if this is possible, are you willing to help? And what is the that we should do?
I think that we are absolutely honored that we were invited to this conference. And I think going forward that we would love to aid your hospital in any way that we can and continue this friendship where we can learn from each other, because this has been an incredible opportunity.
Yeah. And I think the bottom most important thing is that we care for children. And that's why we do what we do. And children are children no matter where you are in this world, and whatever we can do to help, I think we will help each other.
Again, we're all a team. Anything that we can do that assists in providing best practice for the pediatric population and neonatal population, we are always on board to make children safe. So anything that we can do to help, we will.
All right, thank you very much, Miss Laurie West, Miss Mary, and also Miss Melissa, right, for answering that question. I'm very heartened by what you said. Okay, so can actually make this friendship even much longer rather than just in this webinar session. All right, for the next question, since we are talking about PICU and NICU, we are working a lot with children as well. Nabil actually asked how to minimize the impact of hospitalization on children who are treated in critical care rooms.
Yeah, I think one big thing is we implemented the A through F bundle from the Society of Critical Care Medicine, which I mentioned was in the adult world is called ICU Liberation, but it has trickled down into the pediatric world, where it really helps reduce the risk of pediatric intensive care syndrome is what it's actually called. And we, again, highly encourage families to be partners in care, to be with their child 24 hours a day, and to help with the decision-making around what's going on with their child. And we really find that implementing that bundle and having families present really reduces the risk to the mental health, the physical health of children.
Yeah, we definitely have different roles in our hospital also that focus on the emotional needs of children. We have a role called a child life specialist. They're integral in the PICU at least, in helping explain situations that the child may encounter, whether it be a procedure, a treatment, individuals who need to come into their room to take away some of the fear of what may be happening at a developmentally appropriate level. We also have pet therapy, where you have certified animals that come in on a rotational basis. We found through studies that they can drastically reduce the child's stress during hospitalization, also helping with those bundles, but protecting their emotional and mental state.
And that was studied through looking at cortisol levels. And that when the pets came in, the pets jump up and get in bed with the children, and their cortisol levels went way up.
Their cortisol levels went way down when the pets came in the room, and we found that they reacted so positively to it. It's been a very successful program here.
The thing we do in the NICU, we have a developmental specialist And they have to be NIDCAP certified, which is the Newborn Individualized Developmental Care and Assessment Program, because our patients, they can't speak to us and tell us what they're trying to say. So we have to read every little thing that they do to be able to understand what are they trying to tell us, because babies, they don't speak the same language as everybody else. They don't respond to pain the same way that you and I will. So how do we then look at them, look at what are their vital signs telling us? What are their movements? What are their reactions to things telling us, so that we can best provide care for them? Because especially with preterm babies, you don't necessarily see what your cares are doing to them in this moment. It's about 15 minutes later that you actually get to see it, because they don't have myelinated neurons. So it takes a while for their brain to receive the connection of everything that just happened. So NIDCAP training and developmental specialists, those are the people that help us learn the language of our babies so that we understand what they're telling us.
Okay, so that's how we actually lower down the impact of hospitalization. It's basically trying to help these children understand, help them understand why they are in the hospital and how to cope. And one of these, it's very interesting that you have pet therapies there, because we don't have it here. I think we should implement that. Yeah.
I agree.
So the reason that cortisol levels decrease is because it actually, whenever you pet a dog or you pet a cat or you snuggle with somebody, and like we see across the world, those pictures of babies laying on their dad's chest and they're both passed out asleep. Because in those moments, the cuddle hormone oxytocin is released, and it binds to all of the cortisol sites so that cortisol no longer can be utilized. So now you've got somebody that is relaxed and cuddly and feels safe in their environment. Pet therapy is a huge part of that.
In our pet therapy here, the animals go through very special training. They have to pass.
Your sound was too soft.
Oh,
your voice was too soft. I'm sorry. Yeah.
Our pets have to go through special training programs and be certified. And then they're cleaned very, very well before they come into the hospital. Before we can touch them, we have to have all our hands have to be clean. They don't go into someone who has an infectious diseases room, so they don't pass infections from one patient to the other. So there's protocols around it, but we have cats and dogs and a rabbit and different animals that come in, and it just makes the nurses so happy when they bring the dogs, and the nurses are just all thrilled by it as well too. So
okay, great. I also like cats and dogs and alike, so we should most probably implement that. Maybe it can also lower down the anxiety level of children who are hospitalized in Indonesia. And for NICU wise, because since we don't know how to communicate with them, we over at Phoenix Children's Hospital, you have developmental specialists to help understand newborns better. All right. I hope that answers Nabil's question. Let's move on to the next question. We talked about just now how family are also very involved in children's care over at Phoenix Children's Hospital. Can I just ask, Aisha actually asked, what are some of the things that family do that helps in the care of their children who are sick in the ICU, in the NICU or the PICU?
Well, I'm going to start with the NICU, because in the NICU, we have the parents do everything that they possibly can with our assistance. So if you have a baby that is intubated and requiring a ventilator, I may hold that tube to keep the tube safe, because they're not going to go home with that, and have the parents do the diaper change, have them do the breast milk for oral care. I love doing that with moms of our super sick babies because it never fails. We put a little bit of a drop of breast milk from their mom in their mouth, and they start sucking on it and reacting in such a positive way that now mom is going to make more breast milk. Baby is going to get all of the benefits of the breast milk, and anything that I can do to help increase that feeling of them being able to be a parent. There are times where our babies are so sick that you would think, oh, no, we can't let the parents do things. And honestly, those are the moments that we should be having the parents do things, helping bathe them, help them do range of motion. I teach them little foot massages and hand massages, because anything we can do to help the parents remain at the bedside means that for the rest of that child's life, they will always be a part of their care, which means I've got the best advocates for my patient going forward, instead of, oh, I'm going to do all of the things. And then all of a sudden they're getting ready to go home. And now they've got this child that they've never gotten to care for, and they have to learn all their cues now. I want them to learn them from the moment they start till the moment they go home.
I think in the pediatric ICU, we share a lot of the same strategies in keeping parents at the bedside as active as they feel comfortable in. And the nurse is always there acting as the safety, whether it's watching tubes, a breathing tube or a central line, asking them for assistance during our full turns and linen cares and things like that. But also in those children who maybe are too sick to warrant such active participation, the best part of my day is getting to find out who my patient is from their family, right? I get to hear all about this child and what they liked and what they did before they ended up on my unit. I get to hear all about the family. I get to advocate for their concerns and help them share their voice to the doctors, because that can be overwhelming sometimes, standing in front of a team of doctors when you're a parent and it's your worst day.
We're the safety net as nurses.
Okay, I would like to ask just like a further question, because previously we had this like pandemic, am I right? So
Yeah.
it's all over the world. We have COVID, and how does that affect the parents like care in the ICU, in the NICU and PICU?
We continued to let the parents, so the people who could give consent for the child, so legal authorized representatives, we continued to let those two people continue to visit throughout COVID. We did not restrict family parents during COVID.
Right. We weren't allowing like grandparents or sibling visits during that time because it was deemed a little unsafe and it was more protective. Oftentimes our parents were alternating out in the room. So it would be one parent at a time, especially if they had other children, but they were still present and active in cares. They wore the same infection prevention measures as all of us did.
Yeah. Masks and gowns.
And in the NICU, we did have to restrict if they had some sort of a cough or they showed signs of having a respiratory illness. However, one of the things that we did request, especially from those moms, is we wanted their breast milk. So I used to joke with the dads that it's the milkman's baby, because they would always bring in the little jars of milk for our babies, because then we're offering that protection to their child, and they're still, the child and the mom still are able to bond even if mom can't come in that moment.
And if any of our patients were COVID positive, then the parents could come, but they stayed in the room. They weren't allowed to wander around the hospital. And security would escort them in and out of the hospital. And we provided free meals, breakfast, lunch, dinner to the families. We would bring it to their room. And just so that if they wanted to be there, we wanted them to stay. It's just that we didn't want them to spread COVID around the intensive care. So. And we had quite a few COVID positive children. We saw a lot of children, though more so I think with MISC, the multi-inflammatory, I'm sorry, MISC. I think you've all heard of MISC, multi-inflammatory system from COVID. So these children would have a COVID infection, and maybe 2-3 weeks after the infection, they would arrive in full shock from this inflammatory response from the virus. So that's a little different, but we did care for quite a few of those kids as well.
In the NICU, we didn't actually take any COVID positive babies. We did, however, have quite a few babies that were born to COVID positive moms. And so those were also times where we had to, again, figure out ways that they could interact. And actually in our NICU, we have cameras so that the parents can log in and see their baby no matter where they're at. We did have a couple of times where that's how the siblings were introduced to the baby. And it was always really cute because mom would come in and be like FaceTiming with the baby and the sibling would be reading a book to the baby and getting to see like how were they responding. So we had to come up with some pretty inventive ways to keep all of the families involved, because taking care of these children, it's a group effort. It takes a village. It takes the entire family.
And in the, we did develop a COVID ICU. So we did try to cohort all of our COVID positive patients into about 24 beds. We did expand that it kind of went up and down, but it was also good because we could cohort the families, the patients all in one area. And it was a negative pressure environment. So everything was being sucked up out of the whole unit and not blown, the air was not blown out into the rest of the hospital.
Okay, that's a lot of preventive measures, especially during the COVID era. It's a good thing that we don't really, it's coming to an endemic for COVID.
Yes.
Yes.
We still have a few positive COVID patients, but just like a couple. So,
well, I feel like, didn't the CDC recently say that we are no longer in a pandemic for COVID? Now we are in the sustained phase. So finally.
Yeah, finally. We can go back to how it's before COVID. Okay, so that's how parents are involved. Maybe it's pre-COVID or post-COVID or also during COVID. Okay. For the next question, as you said just now in your presentation, you talked about pressure injury, right? How is it important such that we don't, that children doesn't develop edema? What do you guys usually use? I'm sorry, what do you usually use for pressure injury prevention? What are some of the things? Maybe it's a question from Anissa Wenti from one of our students. So.
In the ICU, we have these specialty beds. We own 20 of them that stay in the ICU at all times. They're made by Stryker, and they're very, very high grade mattresses with alternating pressure. That does help. We put some of our sickest patients on those. We do religiously turn our patients every 2 hours. We use the Braden QD evidence-based skin assessment tool, and we do full assessments with 2 nurses at least once a shift, the initial, and then we look at devices that are anywhere touching the skin, and we are checking those every about anywhere from 2 to 6 hours, rotating.
So oftentimes those devices, if we can, we're trying to mobilize them off the skin in different areas. If we're unable to mobilize them, then we're looking at different types of product to pad and reduce how much device is actually touching the skin. Oftentimes, for an example, in a central line, we can use something as simple as gauze for the tails of a central line. or a burp cloth or a pillowcase to wrap around the lines to keep them from resting on the skin. We're still checking underneath those to make sure that there's nothing that we missed, but it doesn't have to be difficult. It doesn't have to be complicated. We have different types of specialty pillows that we use and positioning aids when our patients are on their side positioning. Sometimes we have patients prone positioning, different protocols and things like that. What we remove from normally the front of the patient, you'd have EKG leads on, and if they're prone, you put them on their back. So just getting creative, trying to use device anchors like a Foley anchor that has maybe a swivel so that we have more positioning ability, and then types of foot drop prevention. We have specific boots that help immobilize to keep foot drop from happening. We also have sequential compression devices to keep the blood flowing, reduce how much edema or the risk of thrombus there is in the lower extremities.
And very big proponents of early mobility. We know the sooner you get up and out of that bed, the sooner you're going to get better. So we just know.
Yeah, if our patients don't need to be sedated, we don't attempt to completely sedate them. I would much rather have a patient who is active in care, even if they have a breathing tube or they're on ECMO or central lines, and they're kept safe, than have somebody who's sedated and at such high risk.
I think this is where nursing care is one of the most important things, because the leading way to know what do we need for this patient and can we prevent it is the nursing assessment. Because if I can catch it before it becomes a real pressure injury where I can see, oh, there's a little bit of redness, I definitely need to move this and intervene early, then I can prevent most of the pressure injuries from occurring. And when we know that these patients have edema or lactic acidosis, then we know they're at even higher risk, and that Braden QD pulls that into that assessment. The more devices they have on them, the more area that we have that we can injure. So the nurses being at the bedside and putting eyes on their patient and making sure that they are looking for those simple, like small signs that something could be happening, and rotating those devices and moving the patient. Those are the things that is the art of our profession, is making sure that we can assess those people and make sure that we're doing any intervention to keep it from happening, instead of worrying about, okay, oh no, now I've got all these pressure injuries, now I have to do all of these other interventions. If we can catch it before then we're doing our patients the best good.
I'm sure as a nurse, there's a lot of things that we have to deal with, and one of which is, especially in the ICU, PICU and an ICU, it's definitely the edema or the pressure injury that could happen to them, because most of the time they'll be like lying in their bed, and that's why it really cracks our mind as nurses. How do we actually manage this? How do we actually ensure that we don't harm the patient even more with edema and all that? And it's good that over at Phoenix Children's Hospital that they have specialty beds and also pillows that helps a lot with the blood circulation, and also helping preventing the pressure injury. Okay, I hope that answers the questions. Let's move on to the next one. From Priska Fitriani, she's one of our students here. She asked, as a pediatric nurse, since now, okay, maybe this is not in all countries, in developed countries, mostly, they experience low birth rates. One of the examples maybe Singapore, Japan, they have these low birth rates. And as a pediatric nurse, can this problem actually threaten the pediatric nurse profession, since like most of our patients are children? What do you think about that?
I think that, unfortunately, there will always be a need for pediatric nurses. And I think that that need will probably come in waves. We just experienced a great need during the COVID pandemic. And while most of our children thankfully didn't have severe COVID infection, we didn't stop seeing things that bring them to us every day. There were still car accidents. There were still types of infections, sepsis still happened from other injuries. Children still needed surgeries. And so while I think in those countries that maybe are experiencing lower birth rates, they may initially be impacted, but overall, I think that children are always going to need access to this care. And I think that we will go where the children are, right? We are certified in this and we've dedicated our lives to this. And it may provide for some travel opportunities for some nurses who may not have seen that as part of their career path.
Right. I think the nursing profession is never going to go away. I think when you go into nursing, you're needed anywhere on this whole planet, even in outer space someday, I'm sure. So I feel like nurses are gainfully employed for as long as there's humans.
And I know a lot of colleagues that started as pediatric or neonatal ICU nurses, and as they had families of their own, they transitioned to nursing roles that they still work with children, but they don't work in the hospital anymore. And so maybe we'll see areas of growth in that avenue as these next years play out.
Okay, so this in conclusion to that, how to I'll summarize it as long as there's always humans in this world, the nursing profession will always still be here. Because definitely, even though we are moving towards a more robotic side, most of it are taken over by AI. Now AI is a thing, and robots and all that, but still, definitely humans, whether it's adults or whether it's like children alike, both of them definitely need the touch of another human being when they are sick. Okay, and this is the final questions from our very own student. So we do understand that we are talking about children here, and just now we talked about how they have this hospitalization trauma or anxiety, right? And most of the time, children cry, right? So a question from In, this person, our student asked, like, how do nurses deal with pediatric patients when they cry a lot continuously?
I think that for me, it's sometimes more challenging to hear an older patient cry versus a baby. A baby, that's their primary form of communication, right? And it could be to tell me that their diaper is wet, or it could be to tell me that they're just unhappy in the position that they're in, or they need a good cuddle. But when you hear an older child cry in response to something that maybe you're a part of or doing, I think there's always a part of our heart that's going to be a little sad about it. And what I found that's helpful to me is trying to explain to that child that what I'm doing, why I'm doing, and that it's totally okay that they're crying and they're not happy about it, right? It's unfortunately something that I can't fix. And when it's completed, I try and give them something that's going to comfort them. Most often it's their parent, right? Crying oftentimes is thought of as something that's bad or unhappy, but it's a completely normal response in a uncontrollable situation for them.
And the other thing that does help a lot with crying, we have child life here, like Mel had mentioned, they're usually masters prepared in child development. And what I've always learned from them is that distraction is extremely powerful. So if someone is crying, try to distract them with something else. Maybe it's a book, maybe it's a song, a movie, a toy, bubbles, anything to get their mind off of what is immediately happening.
We're often in a situation where I'm grateful that what procedure they're undergoing is not usually painful. Oftentimes we've given some sort of medication to make them more comfortable. What's usually more fear-inducing or causes the crying is having to be positioned in a certain way or having a lot of staff in a room that can be very overwhelming for a child. And so our child life therapists are great in the distraction, but also the explanation. We allow them to be the one voice so that the child doesn't get overwhelmed by every provider in the room, well-intentioned, saying, you're okay, when they're clearly not.
Right. And One Voice is an acronym that our child life specialists have implemented, where, like Mel said, it is only one person talking is what that means. Everyone else zip it and let that kid focus on one thing and not be overwhelmed.
I think the thing that we do in the NICU is we look for ways that, because it's really hard to distract a baby because you can't like blowing bubbles means nothing to them. But what is the best way that I can do something that I know may cause them to cry and have them be as relaxed as possible? I guess we're lucky in the NICU because we have sucrose, a couple of drops of that, and then a procedure. 9 times out of 10, you can get away with them not crying. But it's not about the fact that they're crying, because, you know, when they're in those early developmental stages of the infant period, it's that trust versus mistrust. It's okay, they've had to cry. What have I done afterwards to help soothe them? So do I swaddle them? Do I do some skin to skin with their mom? I'm not doing skin to skin. The mom is doing skin to skin. What are the things that I can do that help them after I've identified what is causing the problem, or if I've had to be the one that caused the crying? What do I do afterwards to help them now shift states to, okay, I am safe. It passed and I'm safe. My mom comforted me, or my caregiver was able to comfort me. So really working on those kinds of strategies.
Okay, back to the previous question also, how to deal with actually children and also in general pediatric patients, is that nurses really have to crack their brains and how to handle them, especially when they cry. Thank you very much, Miss Lori, Miss Mary, and also Miss Melissa. We are coming to the end of this session. It's a very engaging one from the Phoenix Children's Hospital and also from Stika Sperta Medica. I'll give this opportunity for you to have this closing statement before I take over.
Well, I just want to thank you all for inviting us. I love what I do. I love being a NICU nurse. I love my babies. And I am so excited that you guys wanted to hear about my love of those babies.
I echo what Mary said. I just love what I do. I've been doing it for many, many years. Every day is a special day. And I look for those small special things. And I thank you all for inviting us to be able to share. And I also want to say to all of the nurses, here it's a National Nurses Week. So happy Nurses Week to all of you, and thank you.
Thank you. We appreciate you so much. Thank you so much for this opportunity. I can't believe that it's been 17 years I get to do this, and every day is something different. So if this is the career that you choose, you will not be bored. I can tell you that.
We're all
smiling, and we still very much enjoy what we do. At the end of the day, we just love taking care of children. So thank you again for allowing us this opportunity.
I think I should also thank you guys for being here today. Please allow me to take some highlighted points from today's session. So today we learned a lot of things about the regulatory requirements, nursing licensure, and nursing certification, and what are some of the things that we do in the NICU and PICU ward back at Phoenix Children's Hospital. And you also shared with us a lot of things on how to help children, and also your compassion for each and every one of these of the children that you care for. All right, and finally, ladies and gentlemen, we have come to the end of the first session, and I do hope one day all of us nurses will be able to strive forward again and maybe have more pediatric nurses. Okay, that is all from this first session. I'll be handing it over to Miss Rani.
Thank you.
Thank you to Mrs. Melissa Philippia, Mrs. Lori Rhodes, and Mrs. Mary Calloway for the speech, and Ms. Mika Mailan that has led the first session. To all speakers and moderators, we want to awarding the certificate of appreciation. Okay, thank you. Dear ladies and gentlemen, I want to remind you again that certificate will be given to participants who take part in this seminar for at least 5 hours. So stay tuned until the webinar is ended. Ladies and gentlemen, the next we will show you a video about a success story of Stikes Pertamedika alumni abroad. Please watching and enjoy the video.
Thank you for the floor, Excellency, distinguished college, and friends. Our gratitude to all the organizing partner for convening this important space today. My name is Muhammad Arif. You can call me Arif. I am an alumni of the Bachelor of Science of Nursing program in 2020 and the Nurse Profession program in 2021. I started my career as a nurse. I once worked as a nurse in Hospital Jakarta, as an inpatient nurse in the COVID-19 room and non-COVID-19 room. I also had the opportunity to serve as a urology nurse for 7 months. After that, I decided to join as one of the outreach staff of the United Nations program in Indonesia, serving under the United Nations Office Drug and Crime Mission in Indonesia. And now, I'm currently living in New York. I was accepted for the staff recruitment selection at the United Nations headquarters in November last year. I worked as a regional service representative for the United Nations headquarters under the United Nations Security Council for the European Union and United Kingdom. Working abroad is one of the challenging things for me, because there are many things that are very different from the work culture in Indonesia, starting from the language, culture, custom, and regulation. Because as Indonesian citizens, there are quite a lot of must be prepared to start a career abroad. And all of that must be prepared for in advance. There should be no rush, certainly. I also hope that in the future, Stikes Pertamedika can produce graduates who have the ability to compete on the international stage. That is for me. Thank you for all of your concern.
Hi guys, I'm Novita. I am one of the alumni Vanstikes Pertamedika, to be exact rank 4 atau regular 4. I've worked at Premier Bintaro Hospital as a nurse, at emergency at the last time, and right now I am currently work as a registered nurse in the Netherlands at the oncology department. For me, entering Pertamedika was one of the best choice I've ever made. Pertamedika was taught me not only about the knowledge as a nurse or the skills, but also they prepared me for mentally. They trained me to deal with all situations that I need to know at work. For me, I hope Pertamedika will continue to do this and develop it, of course. And for the younger generation, if you want to be a great nurse, from skills, knowledge, but also mentally, I think Pertamedika is the best choice.
Assalamualaikum, perkenalkan nama saya Sri Astini. Saya adalah salah satu alumnus dari Akademi Perawatan Pertamina angkatan kedua yang menempuh pendidikan di Akademi Perawatan Pertamina sejak tahun 1990 dan lulus di bulan Agustus 1993. Saat ini saya bekerja di salah satu rumah sakit pemerintah di Kuwait, yaitu Al Babten Center. Al Babten Center adalah satu-satunya pusat rujukan buat pasien-pasien bedah plastik dan luka bakar. Alhamdulillah, saya sangat senang bekerja di sini. Banyak pengalaman yang sudah saya dapat, bertemu dengan orang-orang baru setiap hari, bertemu dengan pribadi-pribadi yang unik. Alhamdulillah, semuanya saya nikmati. Alhamdulillah, berkat didikan dari Akademi Perawatan Pertamina merupakan salah satu modal yang sangat saya rasakan, yang menempa saya untuk bisa sabar, untuk bisa teguh, untuk bisa konsisten bekerja di Kuwait, menerima feedback yang baik dari teman-teman di sekitar saya, membawa nama baik negara, membawa nama baik institusi, dalam hal ini Akademi Perawatan Pertamina. Saya sangat bersyukur sekali, alhamdulillah bisa bergabung dengan Akademi Perawatan Pertamina. Untuk Akademi Perawatan Pertamina, dalam hal ini Stikes Pertamedika, terima kasih from the bottom of my heart. Terima kasih atas tempaan didikannya selama ini yang bisa membuat saya bisa berdiri tegak sampai saat ini dengan bangga menyebut diri saya adalah perawat Indonesia. Semoga Stikes Pertamedika ke depannya bisa lebih sukses lagi, mendidik calon-calon perawat profesional yang bisa bersaing dimanapun mereka berada. Sekian dari Kuwait, salam sukses selalu. Salam.
Dear happy audiences, for the second panel session, let me invite our speakers to attend. Please welcome Your Excellency, Mrs. Erin Madeloy, RN MHM, and Mrs. Prof. Madya Dr. Haliza binti Abdul Rahman, which will be guided by our moderator, Mr. Nurse Ian Solihin Eskel. Before the moderator take over the session, let me read the moderator CV. His name is Mr. Ian Solihin. He lives at Jati Bening Estate, Bekasi, West Java. His educational background is Academy Nursing Health Department Jakarta and Bachelor Nursing of Stikes Pertamedika. He also has many certifications according to his expertise during 1989 until 2022. Ladies and gentlemen, please welcome Mr. Ian Solihin.
Okay, thank you for the introduction. Assalamualaikum warahmatullahi wabarakatuh. Good day and good day to everyone in this international series of Pertamedika. First of all, once again, I would like to thank you to all my teacher here, my dear fellow and student who attend this international webinar with, I think this one is very interesting theme. Just like you saw on the video, that was a very interesting video and very motivating. Because this session, the title is Becoming Professional Health Worker Abroad. And of course, some friends of mine, they're working overseas as well. Yeah, most of them went to the Middle East, some to the US or even Australia. And for some time, I feel very envy for them because of their success story, right? But even I know, of course, there's a lot of sacrifices, struggling, and blood and tears they've been through. But finally, they did it. Yeah, I think that's hats off for all you, for all you. And for this second session, we have two honorable guest speaker here, who, of course, expert on their field. Yeah. First speaker is Mrs. Erin Marie Lloyd, RN, MHM. Yeah. She is a technical consultant, EMC Healthcare Group here in Indonesia. Ms. Erin has so many experience, I think, on nursing work history as a nurse manager, technical advisor, and clinical consultant as well. Yeah. And the second speaker here is Professor Haliza, also has so many degree and experience as a lecturer. She has a PhD title at 2005, and now is associate professor in University Putra, Malaysia. So let's welcome to our first speaker here, Mrs. Erin Marie Lloyd. Her presentation today is about standard of competency for overseas health nurses. So those topics are very interesting, and I hope at the end of the session there will be a lot of questions from all you all. Yeah. So without further ado, please welcome our first speaker, Mrs. Erin from Australia. Mrs. Erin, the time is yours, and you have about 20 minutes for presentation. Thank you.
Okay. So, selamat pagi, and welcome to everyone for the Stikes Pertamedika webinar today. It's very exciting, and you've already had some great speakers that I've been listening to from the University Pediatric Hospitals in America. So I've been asked to speak today on becoming a healthcare worker abroad. and more specifically to talk about the standard of competency for overseas health nurses. So just a little bit about me. I am originally from Australia, but I live and work in Indonesia. And my slides, and this is a little bit about our group. So the EMC Graha Hospital Group in Jakarta is part of the MTech Group, which is primarily a telecommunications and digital company. But we believe that we're a very important part of the MTech Group, and known as EMC Graha Kedoya Group. We also have 8 hospitals in Jakarta, and all our hospitals are either CARS accredited or JCI accredited, which is our Graha Kedoya. Later this year, we will apply for JCI accreditation at EMC Alam Sutra and EMC Tangerang. And the plan over the next couple of years is that all of our hospitals will achieve JCI accreditation. So today I'm going to talk about the content today is about competency, about core nursing competencies, international nursing organisations and their comments on competencies. I'll also speak specifically about the national competency standards for a registered nurse in Australia, speak briefly about English competency, and then finally conclude about some nursing similarities and differences between Indonesia and Australia. And what I will do is I'll speak in English, but my slides are presented to you in both English and Bahasa. So I think it'll just make it a little bit easier for you. All right, so if we look first at what a competency is, a competency is the ability to do something successfully or efficiently. And when we look at a nursing competency includes core abilities that are required for fulfilling one's role as a nurse. Then if we look a little bit deeper into competencies, we talk about the ability to do something successfully and efficiently, and nursing competencies tend to focus around core abilities required for fulfilling one's role as a nurse. Okay, and then if we look at nurse competency, even to drill down further, nurse competency is about behaviour, is about trait theory, and trait theory is the innate characteristics in order to be successful. So in nursing in particular, caring is something that is an innate part of what a nurse does and how they interact with patients. And number 3, holism. Holism is about treating and caring for the patient from a physical, social, psychological, cultural, and understanding and respecting their religious beliefs. So competencies for nursing are a pretty big deal. If we move now towards drilling down a little bit more about competencies, core nursing competencies include safe quality of nursing care, management of resources and the environment, health education and legal education, ethics and moral responsibilities, personal and professional development, quality improvement, research, record management, communication, and lastly, but not least, collaboration and teamwork. I'm going to move now to look at some nursing organisations around the world, and I'm going to start with the American Nursing Association. So the American Nursing Association believes that the public, that's patients and the general population, has a right to expect registered nurses to demonstrate professional competence throughout their career. Number two, they believe that a registered nurse is individually responsible and accountable for maintaining professional competence. Number three, that the nursing profession's responsibility to shape and guide any process for assuring nurse competence. And number four, regulatory agencies define minimum standards for regulation of practice to protect the public. Number five, that it's the employer, for example, the hospital, is responsible and accountable to provide an environment conducive to competent practice. And lastly, the assurance of competence is a shared responsibility of the profession, nurses, professional organisations, credentialing and certification identities, regulatory agencies, employers, and other stakeholders. If we move now to the UK, we can look at how the United Kingdom, this is the Nursing and Midwifery Council of the United Kingdom, they say the standards for practice are applied to all fields of nursing and are set out in four main areas of professional nursing practice. They are professional values, communication and interpersonal skills, nursing practice and decision-making, and leadership, management and team working. Within these four areas, there are two main aspects to the standards. All nurses must demonstrate their knowledge and competence and in order to register as a nurse. These aspects are competencies of all nurses across all fields must know and demonstrate, and specific competencies of each field that the individual nurse is registered in. So that might be, for example, in ICU or emergency or paediatrics. We'll now move to the Canadian Nursing Association. And the Canadian Nursing Association say that nurses and nursing organisations alike should be committed to lifelong learning and continuing competence. Nurses benefit from personal enrichment and professional growth, and it is assurance for the members of the public they are receiving contemporary and high quality care. Competence is defined as an integration of the attributes that comprise competent nursing care within a specific setting and context. And I particularly like this particular association's focus on commitment to lifelong learning, because I think that's a very important part of nurse competency. If we move now to the International Council on Nurses, this is a little bit more specific. This is in relation to disaster nursing, and I'll just read through the main points in this one. You'll see, though, the big focus on communication and assessment and planning and intervention. So in this case, it's about preparation and planning, communication, incident management, safety and security, assessment, intervention, recovery, and law and ethics. So I've given you quite a lot of information on the focus around the world from Canada, the US and UK about what the professional nursing organisations believe are competencies and why they're important. But I guess just to sum up, why is competency so important? And this is our lifelong learning It is about continuing our competency. And when you think about it, in a hospital, if you're the director of nursing or the head of nursing, how do you assure that your patients are being given safe care? And your assurance of that is that you can know you provide safe care for a patient, for the hospital, if you provide competencies for your staff, and specifically your nursing staff. So, for example, when the nurse comes to the hospital during orientation, there should be a set of competencies that you expect your nurses to go through, and they would be the core competencies such as fire and safety, infection control, except for some examples, and then you would have specific competencies for the areas that the nurses would be working in. So it's important not to only do it for orientation, but it's also important to do it on an ongoing basis. And that may be checking all nurses' competencies either every year or every second year. The other thing is that it allows the individual nurse to ease into a transition. So if you're a new nurse and you're going to a new country, having competencies and having education about how things are done allows you as a new practitioner to be able to ease into the environment. If you change jobs and you go to another hospital or another organisation, as a new employee, this also helps you transition into the new environment. And also within a hospital, if you change from being in the nurse in the ICU unit and want to move to emergency, competencies will assist you with knowing if you're able to do the job. And it's really important for nurses to understand if you're not competent or you're not confident that you can do the job, you shouldn't do it. You should ask for help and get training. And competencies are a great way to ensure that you are providing safe practice. I'm going to move on now to looking specifically at Australia. So this morning I was listening to your speakers from the United States, and that was really, really interesting. It was great to see your alumni from around the world working, in Amsterdam for the United Nations. That's wonderful for the university to have your alumni working and living overseas. And I think that's a fabulous experience. And I'd like to say to all the students in the audience, nursing, as I agree with the American nurses, is a wonderful profession. You have chosen the correct job. If you want to travel and work overseas, nursing is your passport. Sure, it's difficult sometimes to get employment overseas. It's very time-consuming and at times frustrating. But once you get there, it's a wonderful opportunity to understand a different culture and a different healthcare system. And I can say that my experience overseas has only enriched my life, not only professionally, but personally. And I have some wonderful friends that I have made from around the world. So let's look a little bit about getting registered in Australia. In Australia, there's a national competency standard for registered nurses, and that was first established in 1990 by the Australian Nursing and Midwifery Council. At the time, the Australian Nursing and Midwifery Council was a peak national and midwifery organisation, and it developed, the reason it was established was to develop a national approach to nursing and midwifery regulation. So what are the standards used for? The National Competency Standard for Registered Nurses are core competency standards by which your performance is assessed. And that could be either a new nurse in Australia who's graduated from a university, or an overseas nurse who comes in and wants to be registered. You also, on an ongoing basis, and in Australia, you have to renew your registration every year. and you have to sign your document to say that you have performed your ongoing education and competency standards. So it is not only to obtain, but it's also to retain your registration as a registered nurse in Australia. The next part I'd like to move on to is to say that in Australia, there are 4 domains of nursing competency, and they centre around professional practice, critical thinking and analysis, provision and coordination of care, and collaborative and therapeutic practice. And more specifically, the national competency standards for registered nurses are not unlike what we've seen from America, the UK and Canada. So they talk about, number 1, professional practice, that the nurse practices within a professional and ethical nursing framework, that there is critical thinking and analysis, that the nurse participates in ongoing professional development of self and others. So that means that you're not only responsible for yourself, but you're responsible for teaching other nurses on how to practice, that you provide and coordinate patient care, that you plan nursing care in consultation with the individuals or groups. So that could be patients or a healthcare community. And significant others is there's patient relatives or guardians or friends, and that you work within an interdisciplinary or multidisciplinary healthcare team, that you provide comprehensive, safe, effective, evidence-based nursing to achieve your identified individual group health outcomes, and that you evaluate how well the patient is responding to the care that's been implemented. And that could be to the individual or the group health outcomes in consultation with patients, their significant others, guardians, and any other people that are involved with the patient. And you do that in the context of an interdisciplinary healthcare team. The next bit I'll just move on to is, this is more specific about a hospital, and this is just a snapshot. So every hospital in Australia would have a set of core competencies and specific competencies that are required by specific units. And as I said, this is just a snapshot for you to see. So they would talk about, on the left-hand side, would talk about the type of competencies, they'd talk about the position, and then they would go, this would be the main matrix for the hospital. And then they would go by ICU, emergency, the ward and the operating theatre, and maybe CSSD. And then it would mark off all the specific areas that the nurse needs to be competent in. And then the next stage would be to make sure the nurses are competent. And this is, as I said, a director of nursing oversight of the hospital to be able to say that this is providing, or this is evidence of providing safe practice for patients. So let's just have a look about the licence in Australia. And it can be a little bit confusing because you have to apply to the Australian Health Practitioner Regulation Agencies. It's known as AHPRA. And AHPRA is made up of 13 different healthcare areas. Nursing and midwifery are a couple of them, but this organisation looks after doctors, dentists, occupational therapists, physiotherapists, dietitian, and all the rest of it. So when you get into, if you look up AHPRA, you then need to you need to drill further into the nursing and midwifery areas. So you have to get registered with this group to work as a nurse in Australia. But before you can work as a nurse in Australia, they have to assess whether you have a recognised Australian or international qualification in order to be registered. And from what my reading is showing is that in most cases, they will review the nurse on a case-by-case basis. So when you get into the system, it often talks about if you're from, New Zealand or New Guinea, that they will accept your registration. But I don't think you should be deterred by that. You just have to keep applying for your registration and just be mindful that it will be done on a case-by-case basis. The other thing too, when you're working overseas, things take a long time. So if you're planning to work overseas, you've got to realise that it may take 4 to 6 months. So you've got to get registered, you've got to get a job, and you've also got to get your immigration, your visa to work in the country. So it's been my experience that you shouldn't underestimate the time that takes. And also it's often good to plan maybe 6 months. You're not going to be there for 6 months. So sometimes when you plan to work overseas, it's all very exciting, but actually getting there can take time. Okay, so one of the hurdles of working in an English-speaking country is that you need to communicate in English. And you all know that communication is a really big part of nursing. And it's not discriminating against people from other non-English speaking countries. It's just basically that every nurse has to communicate all the time with patients, with staff, with doctors and other health professionals. And even if you look at the registration that's now being offered for doctors in Indonesia, one of the requirements is that the doctor speaks Bahasa Indonesian, which is only fair because people have got to be able to communicate effectively. So there's one of the things how they judge in Australia your ability to speak English is by doing testing, and that can be through IELTS or any other number of other places that you can have English speaking assessments done.
Excuse me, Miss Erin, your
Yes.
time is 5 minutes left.
Okay, terima kasih. Okay, so just before I finish, I found this really good article that's just been done about similarities and differences between Indonesia and Australia. And I thought this would help you a lot with trying to understand, if you decide you want to come and work in Australia, this report gives you quite a lot. It's a big report, but I've just picked out some of the similarities and differences. So it's just a new report. It was just released in December 2022, and it's a comparative study. And it's done by what they call IA-CIPA, which is the Indonesian-Australia Comprehensive Economic Partnership Agreement. Okay, so if we want to look at some of the similarities between Indonesia and Australia, and I can tell you there's a lot of similarities, I've seen it myself, are that nurses in both countries focus on holistic care, patient-centred care. They're mindful of legal and ethical considerations. They work within an evidence-based practice model, that there's a focus on patient safety and quality of care, that professional relationships are important, and there's a need to support the education of others. That means teaching of other nurses and other types of students, that there's continual professional development done. There's health promotion done for patients. There's an allocation of health resources, that care is across the care of the continuum of care, and there's culturally sensitive care delivery, and health and well-being of self is important. So the good news is it's a lot like working, if you're going to work in Australia, it's going to be a lot like working in Indonesia. However, there is a difference in between the greater emphasis in Australian standards on some aspects, and these are that professional nursing, professional decision-making, accountability and autonomy is, I think in Australia, nurses take a more proactive role and they are valued more by the healthcare team, in particular by medical staff. There's more, the nurses are encouraged to do reflective practice. That's a lot of journaling. and understanding how they're feeling about the day and dealing with the patients. There's a strong collaboration practice with other health professions and in particular medical staff. The delegation and supervision of care to other health workers by registered nurses. There's also reporting of notifiable conduct of health professionals. So under APRA, it's responsibility of the head of nursing or the director of nursing. If a nurse is not performing professionally, they need to be reported to APRA, and that's a responsibility that's taken by the head of nursing. Risk reporting is a big deal for Australian nurses, and practicing within one's scope of practice is very important in Australia. So, for example, I often use the example, if it's not a full medication order with all of the details of the patients recorded on the medication order, in Australia, you cannot give that medication. And you would have to ring the doctor and ask them to write out a full prescription. So I find that's just probably a little bit different in Indonesia. The other thing is the focus on the health of Aboriginal and Torres Strait Islander peoples and the promotion of the nursing profession. So just before I finish, I just want to tell you the good news is there's lots of jobs in Australia. The Australian government really encourages nurses to come to Australia. And there is the career prospects for nurses in Australia is particularly promising. And this bit is just to tell you how welcome you are. So nurses, Australians love nurses, and nurses are thought to be in all professions the most ethical and honest of all professional groups. So you can see this data has been around for about 20 to 30 years. Nurses are highly regarded and thought to be a very, very important part of the healthcare team. So with that, I will conclude my presentation, and I thank very much Starks Kota Medica for the invitation today. And I want to wish all the students and all participants a very happy Nurses Day for the 12th of May this Friday. So terima kasih.
Okay, thank you very much, Mrs. Arin, for your great presentation. That was a very interesting topic actually to talk about, because maybe some of us want to follow our friends' previous video to walking abroad. So maybe to all the audience who interesting to walking overseas, maybe can ask the question or have some trick and tips from Ms. Arin, because as we know, if we walk to overseas, it's not actually need the hard skill, but also the soft skill as well to do some kind of job. Let me remind to the audience who want to give a question, you can write it down on the link which provide on the chat room. Yeah, you can write it down in Bahasa as well. So later on, maybe I will try to translate for you.
Terima kasih.
Okay. Now for the second speaker, please welcome our second speaker, Professor Heliza from University Putra Malaysia. Her presentation is about higher education as a global entity in the implementation of sustainability science. To Professor Heliza, time is yours. Thank you.
Assalamualaikum and very good afternoon to all. Thank you very much, Mr. Moderator, to give me opportunity to present or to share the knowledge regarding how the education as the entity to implementation of the sustainability science. Okay. Okay, now I've been given the title for my presentation is Becoming Professional Health Workers Ahead, Higher Education as a Global Entity in the Implementation of Sustainability Science. Every of us know what is the SDG, or in short, the what is the Sustainable Development Goal, or in short is SDG. Now SDG is a very important instrument to apply worldwide regarding how to face the environmental problem, especially because of the global warming and also because of the climate change. So SDGs have 17 instruments, including SDG 4, which we focusing today related to the education. So this is my short bibliography. Actually, my field is environmental studies, which are focusing in environmental governance and health, sustainability science, environmental policy and legislation, environmental management, and also the public involvement in environmental related issue. So everybody also know why sustainable development or SDG is important. Now human with their technology and with their knowledge helping from the their knowledge regarding science, and also from the technology they explore their environment in very huge. So the impact now existing, as example, very hot temperature, famine, flooding, so on and so forth. That's why SDG or sustainable development is important, because this kind of the instrument will guide everybody, including individual, the company, the industry, the society, the government, how to manage their country or their environment in a proper way. So the concept of sustainable development proposed by Brundtland is very important. This is important also in our discussing today, because this concept touch regarding the SDG 4, which is the education. So the primary objective of sustainability, including SDG 4, is to meet the needs of the current generation in a way that does not compromise the potential of the future generation to do the same. This meaning definition is given by the Brundtland. Okay. So sustainability management consists of the organizational practices that ultimately lead to sustainable development. And sustainable development are a goal and also a blueprint to achieve a better and more sustainable future for all. Okay. So what is actually a relationship between the sustainable development and education? As I mentioned before, SDG 4 is focusing on the education, where the aims of SDG 4 is to ensuring inclusive and equitable quality education and promote lifelong learning opportunities for all. So from here we know that education is one of the very important and also very efficient instrument in order to nurture everybody, including the student of the higher education, the primary school student, the secondary student, all including the society, where they can change their lifestyle every day in order to make sure that our planet is in a safe condition. So education for sustainable development means including key sustainable development issue into teaching and learning, as example, regarding the climate change, disaster risk reduction, biodiversity, poverty, and sustainable consumption. So what is education for global sustainable development? So education for sustainable development, or in short ESD, is UNESCO's education sector respond to the urgent and dramatic challenges the planet faces, So the collective activity human beings have altered the earth ecosystem so that our survival seem in danger because of changes more difficult in reverse every day. So in 2015, world leaders signed up to the Education 2030 Sustainable Development Agenda to structure pathway to making education accessible to all and the foundation for sustainable development and also for the peace. That's why globally education is the main tools or instrument which focusing by every government in order to nurture their society and also to make sure that with increasing the knowledge of society, including the student in higher education, they can make sure that their life is in a good situation. The planet is also in good condition, and the future generation also not threatened by today's activity. Okay. So what is ESG in higher education? So actually ESG stands for environmental, social and governance. So ESG actually is a set of standards for everybody, not only company operation, that focus on how we manage our environmental impact, traits is everybody, including individual in the society and other stakeholders, and uphold good governance practices. This is actually governance. We refer to the government and also the top management maybe of the company, the CEO. This is a very important one. So actually UNESCO have the guideline, have the SOP and have the rules regarding accelerating education for the SDG in university, which university can use this as guide for their teaching and learning and also every activities in university. So what is education for sustainability development and sustainability? ESD give learner of all ages, including the IPTs student, the knowledge, the skill, values to address the interconnected global challenges, including very important one, issues, climate change, loss of biodiversity, unsustainable use of resources, and also inequality. So what is the role of education in SDG? Actually, through education, the world can achieve all the 70 SDG. As we know, the SDG 4 focus on the education solely, but through the education, the world can achieve all the 70 SDG, including very important one, the SDG 3 regarding the healthy lifestyle, and also SDG 1 regarding poverty eradication, where have a significant impact to the environment and also to the health. So why is education for sustainability, sustainable development crucial in achieve the SDG 2030? Actually, education as an instrument can make sure we can achieve the SDG 2030, because everybody with the education can be increasing their knowledge, attitude and practice, how to interact with their environment in good manner, and then with that we can achieve a very peaceful and also prosperous world. So education gives people the knowledge and the skill they need to stay healthy. This is very important one. Because from the education instrument, sustainability focused learning outcomes, we can achieve the 2 points. Student will be able to define sustainability and identify the major sustainability challenges, and also at the same time student will understand how to carrying capacity of ecosystem relate to providing the human health. So this can change their attitude, knowledge and practice regarding environment. So they in future have this kind of knowledge, they maybe can nurture another person near to them how to interact with the environment in proper manner. So this is very important, because as a young leader, the university student need to be support by this kind of knowledge to make sure in future they do not repeat whatever whatever done by their or by previous leader. So actually that's why education regarding SDG need to be practicing and it need to be introducing in the higher education, because the sustainability is the key to better future. So this is very important, how the education can be have a role in that. So actually, in the early 1970s, Stockholm Conference on Human in 1972 was first initiative to identify the role of higher education in progressing sustainable development at the level of international, then followed by the Belgrade Charter in 1976 and Tbilisi Declaration in 1977. So as early as 1917, the world have effort to change the world in a better future through the education. So these are the outcome of the world first intergovernmental conference on the environmental education organized by UNESCO cooperation with the UNEP. Okay. So then by 1987, followed by the Brandon regarding the SDG with her famous article, Our Common Future is the further development, the idea of sustainable development, and the United Nations Conference on Environment and Development 1992 in Rio. These all acknowledge the importance of education, and in higher education is progressing sustainability in our societies and around the world. So, and then followed by 2000, the United Nations launched the MDG, focus on reducing poverty and improving the educational opportunities. Then from that, we have Agenda 21, we have 36 chapter, and also Agenda 21 from the Rio recognize the education to increasing the public awareness, and also to make sure that we can have a successful implementation of SDG.
Excuse
That's
me,
why,
Prof. Haliza.
Yeah.
Maybe I interrupted a while. Maybe you can change your presentation screen to the slideshow for better reading
So
for the audience.
where can I find the slideshow? I cannot find here. So where is the locate?
Usually at the mark of the play.
Play.
At the bottom, the right bottom.
The right button, more. Is it more?
No, slideshow start. Usually.
Slide. Slideshow.
No. Yeah, at the right. Usually at the right button. But it's okay. If you cannot find it, just continue, please.
Usually at the bottom, but this time I cannot find. Okay.
Oh, okay. It's okay.
Okay. So
Let's continue.
education is very essential for promoting the sustainable development in worldwide. So higher education have a role in implementation. The SDG, the concept, the theory, the practical, the implementation, so on and so forth regarding this to the student where when they are learning in the higher education. This is very significant to university as higher education to nurture their student regarding this. So university and higher education network can conduct research and provide advice and guidance on strengthening national education system, as well as aspect of capacity building for SD across different sectors. So now we focus on ESD and also higher education. So HEI or higher education institution can provide expertise because we have more expertise in university. So in higher education, we have so many expertise academia with different expertise. For example, maybe in expert in air, expert in pedosphera, atmosphere, and so many expertise. So in here, we can use this expertise to give our student the KAP, the knowledge, attitude, and practice regarding the SD. So this is very important. Why the higher education have a very special task or can be allocated to nurture the student, the future leader of our. So they can combine the knowledge and experience at the local level with information with the higher level. And HEI also can strengthen the interface between research finding and decision making using evidence-based data as well as problem-based scientific research. This can be applied through the teaching and learning when we bring our students to the fieldwork to do some maybe data collecting, to do the experiment. This can be done in teaching and learning. So university and higher education institution have a key role to play in all the ESP and also JAP parity action area. And also, at the same time, higher education has stepped up effort to support SD. So HEI have made significant effort address sustainability in campus operation, supported by the development and sharing tool and reporting the framework. Okay. So according to TIPBRI 2011, sustainability challenges the current paradigm, structural as well as effective practices in higher education. So university and higher education institutions are facing this reality as they need a meaningful contribution to the sustainability. And according to Lozano 2006, higher education are leading social and cultural change from the forefront through research-based finding and through the education or intellectual leader and future maker. This is also argued by many scholars and also many expertise regarding higher education can change the world through training and expand young mind, researching answer to challenges and supporting the public policy. Therefore, many universities in the world now, especially the public university, which are sponsored by the government, have taken vital initiative to transform into an institution of higher education, higher learning with sustainable India central agenda. So university educate future decision maker and bridge the gap between research and society. As a matter of necessity, the future graduate will require a clear understanding of sustainability to successfully leading the nation. So academic institutions have taken many initiatives incorporate to implement whatever we agreed in the global convention, global protocol, so on and so forth, to apply, especially the Agenda 21 within their academic syllabus as well as campus-based activity. Okay. So HEIS have introduced sustainable development issue into their curriculum for teaching, learning, and research to target to achieve the sustainability. And we must know that this SD, sustainable development, need to be implemented to whatever discipline, science, social science, engineering, not only for the environmental sciences or environmental studies or environmental management student. So for all students, maybe as a general subject to nurture them as early as we can for the future leader. So there are some institute and center offering the multidisciplinary approach to teaching and learning on sustainability. This is a very good progress. So now I have one example from Malaysia regarding one of our public university in order to very aggressive, very efficient to introduce the sustainable development syllabus activity to campuses, including the student. So University of Science Malaysia has started to embrace the education for sustainable development (ESD) as university as a living lab approach since early 2000 through the concept of campus sejahtera, or in English healthy campus, and the concept of university in garden. This is how the top management of the university implement this to the environment near the in university to make sure that the student can digest whatever they have in class. Then they can see or can practice in the campuses in everyday living. So USM aims promoting sustainability among the community, inter and intra the campus. And then from 2013, the USM introduced have a Center for Global Sustainability Studies. Their role is to conduct to help USM in mainstream of SDG within the university. And then they design the work with all relevant section, all the stakeholders in the university, including the community outside with the NGOs and very large stakeholder to dispower the bottom billion regarding SDG. So from that, from the 2000 till now, so 2013 to 2019, from the concept of SDG introduced in USM, they have already introduced 1,183 courses related to environment and sustainability, 1,478 scholarly publication on environment and sustainability, around nearly 4 million research fund dedicated to environment and sustainability research, and 25 student organizations related to environment and sustainability. This is very good example regarding how university play their role in order to make sure that the sustainable development concept and also regarding teaching and learning on sustainability is very broad implemented in the campuses lah. So however this is some point need to ponder. As we know, as I mentioned, the SDG 4 regarding the education to introduce in society and also in the higher education. However, these approaches are building their sense of responsibility to implement those in their practical life and use for the social development. Evaluation of the effectiveness of this teaching learning program and their pedagogical approaches and endpoint has not been done adequately. So we need to evaluate whether that teaching and learning introduced and also implemented in the campuses, including the teaching of this concept to the student are very effective in order to nurture them to practice of the SD, sustainable development, in their daily life and maybe in the future of their life. So something we need to focus is to evaluate the effectiveness of this regarding to prepare our young leader very integrated with this concept. And also the different aspect of sustainability may cover with various programs, but the student very often fail to relate those those from their individual set of module of the program. This is because the relationship of this aspect is not included in their detailed syllabus. As example, maybe the student of the economics where they took some of the courses, for example, green economy, student can really identify the importance of ecosystem approach in sustainable development because they only focus regarding the economy of the green aspect. However, a student of ecology and natural resources management experiences difficulty in relating his or her knowledge with sustainable infrastructural development or to the sustainable city planning practices. This situation is similar for a student for other monodisciplinary or a multidisciplinary institution as well. Also, we need to focus that it's important have a case of field-based learning approach, which may help students understand sustainability in a broad and efficient way. That means we cannot only give a theory in a class, but we need to bring them to the nature to do some field work to make sure they are really understand what we teach in class regarding the concept and also the practicing. So a more field-based practical pedagogical approach is crucial for graduate students who are more mature and at the final stage to take the responsibility of social services. This is very true because we only have a lot of time with our bachelor student, but not for the postgraduate one, because they are the matured student. Therefore, academia should take this vital issue into account while they design a curriculum for their graduate student. So as conclusion, education for sustainability is a process of developing concern, abilities, attitude, and values towards the net leadership of the society. So we must ensure that their participation in sustainable development activities more effectively in the local, national, and international level, and help them to work towards a more sustainable future. Higher education of a region are responsible of their society, and leader of these academies should relate various aspects and issues sustainability in their research niche through innovation, technology, engaging the community, and interact with the mass pupil. Hence, it is important for the education system to be harmonized with sustainable development aspect effectively in HEIS. So with that, that's all from me, Mr. Moderator. Thank you very much.
Okay, thank you, Professor Haliza, for your great presentation. Yeah, as we know, the education is a very long, valuable investment, manpower, and it can make a huge difference for a better world in the future, socially or environmentally, and all the aspect of the human life, of course. But of course, it's to do that, it's involving very, very so much stakeholder, to make it work properly. Thank you for your presentation, Professor Haliza. Okay, let me remind to the audience that if you want to give a question, you can write it down on the link which share at the chat room. Yeah, let me see if is there any question already or not. Okay, I think it's already some question for this session. Maybe the first question is for Mrs. Erin here. The question is for Anis Rahmatullah, the Stikes Pertamedika student here. His question is the EMC hospital in Indonesia need to get IELTS test to work there? Yeah, because I guess there are some foreigner to get treatment at EMC hospital in Indonesia. Maybe not only EMC, in general, sometimes there has the foreign patient. So, but especially for the EMC group, is there any IELTS pass exam to do the requirement? Thank you, Ms. Erin.
Okay, thanks, Ian. So is it Avis is the student that's asking? Is it Avis?
Excuse me?
Sorry, the student's name?
Anis Rahmatullah.
Okay, Anis. Okay, so thank you very much, Anis, for the question. No, there is no requirement for an IELTS to work at EMC or Graha Group in Indonesia. However, saying that, we encourage our staff to develop their competencies in language, but there is no requirement. Okay.
Okay, thank you for the information. To Anis, maybe you can apply to the MC even without the else.
Definitely, we welcome. We actually sponsor a lot of our students to go to Stokes Perth Medica to convert from their D3 to S1 degree, and we would welcome any applications. So thank you. Terima kasih.
Okay.
Yeah.
For second question, Mrs. Erin is from Ibnu Taris. He's also the student of Stika Seperti Mandika as well. His question is, how about radiology job for opportunities in Australia? Maybe this another like professional job.
Sorry, Ian, can you just repeat the question, please?
How about radiology job opportunities in Australia? I think the radiology.
Sure.
Yeah.
Okay. So thanks, Narajis, for your question. Look, all healthcare, the healthcare industry in Australia is suffering from a lack of employees. So there's a lack of qualified radiographers, physiotherapists, nurses, and all the rest of it. So I guess during my presentation, I said about APRA, which is the Australian Health Practitioners Board. If you were to work in Australia, remember you need to be registered by that board. So what I would do is, in this case, I would do a literature review on APRA, and at least I'd get into APRA and I'd look up what the requirements are for radiographers. But yeah, there is generally a shortage of all healthcare workers in Australia.
Oh, okay, thank you, Ms. Erin. And the other question is from Desmawati. Is Stika Seperti Medika student as well. Her question is, what special preparation do Indonesian nurses need to prepare to work in hospital in Australia? And how to build nurse confidence and tips for new nurses so they can quickly adapt to working there? Thank you.
Okay. So, basically, for nurses to work in Australia, they need to go to APRA and judge whether their training and their education. So remember, that's the Australian Health Practitioner Regulation Agency, AHPRA, and then they need to look up nursing, and then they need to apply to see if their qualification from Indonesia is registrable in Australia. And I mentioned during my presentation that a lot of times this is done on a case-by-case basis. So the student, if they want to work in Australia, need to look at that site to understand a little bit more about working in Australia. The next thing is that you get registered, then you need to find a job in Australia, and then you need to get your visa to go to Australia. So that's when I mentioned sometimes it can take up to 6 months by the time you want to decide to go, and then the processes that go through. In respect to getting confident to work in Australia, I think that I don't think that there's too many dissimilarities between nurses in Indonesia and nurses in Australia, and there's not a lot of difference in the hospitals, hospital work. But I think it's just becoming more confident with your English to speak up. So there is a strong culture of speaking up in Australia. So that means if you think something's wrong, you need to tell someone straight away. So that culturally is a little bit of a challenge for, you know, Asian cultures and European cultures. So I guess it's just learning to be confident to speak in English. And you can take courses in English. You can get, you know, you can, that's not such a difficult thing to do. But I think it's the speaking up and becoming confident. If you're going to work overseas, you've got to realise it's going to be different. And at times it can be frustrating, and at times you don't always understand the culture and all the rest of it. But that's what makes it exciting. And that's why you should work overseas, so that you can appreciate other cultures. So I believe that's answered the question. If Desmaswati has any other questions, I'm happy to answer.
Okay, Ms. Erin. Yeah, basically, we need to get approved the nursing board of the Australia, maybe, yeah. And for the like I said, the soft skill of becoming overseas worker, health worker, is to get over the culture shock. And yeah, of course, you need to confidence with the of yourself.
Yes, I think just I'd like to add, Ian, is that Indonesians, and I've worked in and out of Indonesia for a long time, Indonesians are very, very caring and very respectful of older people. And that is a really special quality, and that would be seen overseas in a very good light. So most of my friends, and my mother used to come to Indonesia quite a lot, she used to think that Indonesians were so respectful of older people. And generally, Indonesians have a kind heart, and that is a really, really big part of being a nurse. So I think that even though there's a few hurdles, I don't think Indonesian nurses would find it too hard to work in a hospital in Australia.
Okay. Maybe another question for Mrs. Erin here. It's from one of the lecturer of the Sticker Sparta Medica here.
Yes.
What topics should be added to the curriculum to prepare students to be ready to work abroad, except English?
Sure. I think that, so thank you very much for your question from the lecturer. I think if you refer to my slide on the practice standards that are greater emphasis in Australia, and that's a evidence-based research project. If you refer to, so that's the IACPA assessment that was done about nursing in standards in Indonesia and Australia. That could be really helpful for your curriculum development. I think that you just need to encourage nurses to teach them to speak up. So if something's wrong, like if a patient's observations are not right, that they learn how to communicate that really effectively, and that you teach them a process. If no one listens to them, then they need to, how they escalate that process is really important, and certainly a strong expectation. So that's about communication. So I think, the more communication you can teach them, the more confident you can teach them to be, the better. I think too that teaching them to work within their scope of practice is really important. So that means that they only do what a nurse should do. So they can't do things that are out of the scope of practice. That's a really important part to teach the nurses about at university. I think too, the other thing is how they communicate. Again, this is communication, how they communicate with their other health professionals, whether it's a doctor or a physiotherapist or a social worker or a dietitian. So again, it's teaching them strategies for communication and learning not to be too qualitative, but to be very quantitative in how they talk to and how they respond is important. The other thing is ensuring that they have, that part of being a nurse is teaching junior nurses to be nurses and making your education, your training very much part of your that's what a nurse does. So you shouldn't expect to get extra money for being a teacher when you're a clinician. That should just be part of your normal role. And that is very much a big thing in Australia, that you have to teach. You not only have to teach junior nurses, but you often teach junior staff from other professions as well. I think they're the main things. So big focus on communication, development, and working within the scope of nursing practice.
Okay, Ms. Rin, and maybe this one is the last question. It's almost similar question actually, but the Naufraya is one of the student of Stikes Perta Medica. Can Indonesian nurse graduates, maybe his mean is fresh graduate, yeah, be recognized and can work directly abroad, especially maybe to Australia or another countries, as your experience. Yeah.
Right.
What should it be prepared? I mean, maybe is there any difference between the fresh graduate with the experience nursing?
Sure.
Maybe,
so to answer your question and to answer Naufra's question, it would be, so in most countries of the world, you cannot work as a fresh graduate in another country. And even in Australia, when someone finishes their university degree, we like them to do a graduate year. So it's always a good idea to get your NERS and in Indonesia, and then maybe work for a couple of years to have some experience. So, I mean, I'm not saying it's impossible, but as an employer, and I've been an employer in Australia where I've employed nurses from overseas, I would prefer them to be experienced nurses. In particular, there's a real shortage of theatre nurses, ICU nurses, all critical care, emergency, coronary care, and NICU, PICU. So if you to become employable overseas, it's good for the nurse to do a subspecialty and to get some training or identified course in that area. So the likelihood of getting a fresh graduate to work overseas is not impossible, but fairly unlikely. I think it's important to have a bit of experience.
Okay, thank you, Mrs. Arin, for your explanation to us. And maybe we move to Professor Haliza. There's some question for you here.
Yes.
The first question from Uwais. His question is, in your opinion, what nursing competencies that very important to be able to support the SDGs?
Okay, so I'd refer you to the core nursing competencies that I spoke about in my presentation. So I think that, again, I've mentioned a lot about communication. Communication is a core, is a basic nursing, basic core part of being a nurse. I think that safe quality of care, nursing care, is really important, and that follows the patient safety movement and all things around patient safety. I think that ethical and moral responsibilities from a competency perspective is important, and record management, and I think learning about personal and professional development are some of the key areas. But remember that, if they go into a hospital, there'll be core competencies, and then there'll be specific competencies for the clinical area. So if it was a postgraduate student, someone doing their master's in nursing, then the competencies would be more specific to the clinical area that they're going to work in or training in. So, for example, the nurses this morning mentioned about pediatrics. So if you're going to be a pediatric nurse, the competencies for a master's degree would be specifically for paediatrics. And at present, at EMC Graha Group, we are actually looking at upskilling our nurses in paediatrics because we've been trying to look for a postgraduate course in paediatrics in Indonesia because we think there's a real demand for that. So I think that answers your question. If not, I'm happy to take questions offline if necessary.
Okay, thank you. Maybe Prof. Haliza has another answer, or you can add the opinion on this question.
Okay, thank you very much for the question. Actually, question 1 and 2 can be answered together. Nurses, as we know, their daily job is related to the disposal thing with the medical instrument, with the something we can classify as also have impact to the environment. For example, they use the plastic, they use the string, whatever, so on and so forth. So nursing as individual in the society and also as a global society need to increase their knowledge, their attitude and practice in order to make sure their daily job can minimize the impact to the environment. That's why we have special or different types to handle the medical disposal compared to the common one, the domestic waste. So all the disposal actually have very huge impact to the environment. As example, use a lot of the glove, the plastic thing, so many things lah, the chemical. So when they have a knowledge on that, they can minimize the impact to the environment. Maybe they have something with the help from the expert of the university to do some research how to minimize the disposal thing burden to the environment. So the first one, the nurses need to increase their knowledge regarding the sustainable development, the concept of the SD, and then maybe from that they can change their practice and attitude to make sure that everything they are doing in their daily life job can be minimized the very dangerous impact to the environment and also to the human. So regarding the what is our role as educator to prepare, so same as us as lecturer, we need also to find to search a new concept, new theory, new knowledge regarding how can we apply this concept, this new concept, this new knowledge to make sure that our students have a very current knowledge on the sustainable development concept, theory, model. No need to focus to the previous one. Yes, we need the previous one. The current one is very important to make sure that our student knowledge, perspective, knowledge and attitude is parallel with the current situation. As example, maybe the previous one only have 17 SDG, but now the United Nations, the UNEP and so on, the agency under the United Nations want to add another SDG which focus on ethics. So maybe 18 SDG will be introduce the number 18, another one, because ethics can guide everybody, very important instrument to behave with a good manner to the pupil and also to the environment. So from time to time, lecturer as a educator need to make sure that their knowledge is very competent with the current situation, current progress worldwide, so they can can use all the knowledge they get to implement it or to deliver it to the student in the class including the theory and practical also, especially when we done outside the classroom, the fieldwork. This is maybe some of the factor need to be focused.
And sorry, Professor Halsall, if I could just add to that. So I think that's really important from a university perspective, and I totally agree with you. I know in hospitals from an operational perspective, and certainly we've just released our EMC sustainability report so most public companies do an annual sustainable report. In that sustainable report, you have to indicate what activities you are doing to improve our impact on the environment. So if what you'll say is true and you teach that in the universities, that would prepare our students then to be active members of like product review committees. We do use a lot of plastics in hospitals, it's really true, but when we're purchasing items, maybe we should be more aware of the impact on our environment. For example, a lot of drapes and things, people use cotton drapes. They're moving away from the disposable drapes. So a lot of those decisions are very practical decisions, and as long as there's no infection control issues, this would be a really big part of an operational part of a hospital. It also would teach the students to be able to participate effectively in product review and doing sustainability within the organisation. So I concur with what Professor Halsall is saying.
Thank you. I agree with you.
Thank you.
Okay, thank you to Mrs. Erin and Prof. Haliza for your clear and very detailed explanation. So we move to the end of the session here. Any final statement from Professor Haliza and followed by Mrs. Erin?
Okay, thank you very much, Mr. Moderator. So from the talk, as I mentioned, clearly that the university role as a center to implement or to make sure that we as educator enrich our student with the very current and very comprehensive knowledge regarding the sustainable development, parallel with the SDG 4 on education. So as a leader, the young leader for the future, the student can make sure that their attitude and practice is very harmony with the environment. That's all. Thank you.
Mrs. Erin?
I'd just like to finish off by saying I wish all the students all the best. Don't forget working in Indonesia is a really good thing as well. And as an operational person in Indonesia, we don't want all our nurses to go overseas. Professor Halsall will tell you that in Malaysia, there's a lot of nurses going overseas. So nurses go to Singapore, the Middle East, and all over the place. And there's a real shortage of nurses in Malaysia. So we want to offer opportunities for our Indonesian nurses, but don't forget to stay in Indonesia as well, or come home to Indonesia. I just wish you all the best with your careers. As the American nurses all said this morning, they are all proud to be nurses, and we should all be proud to be a nurse. And just to wish everybody for International Nurses Day on the 12th of May, a happy International Nurses Day. It's very focused actually on education, our nurses, our future. And it's all a lot about developing our nurses for the future. So terima kasih to Stokes Pertamedica University. I appreciate the invitation and all the very best to the students.
You limitation. Unfortunately, we need to sessions and maybe let me wrap up topics for this session. As we know, in this globalization era, all the worker, including nurses, we improve level of competency, and it's correlated with learning education curve. Yeah, it is a big challenge, but also a big opportunity to us. Yeah, develop and get achieve globally education and competence. For your presentation and strategies and experience with us today. To all the audience for joining the webinar meeting. Take care, stay healthy, stay safe, and good day, everyone. Back to the Wassalamualaikum warahmatullahi wabarakatuh.
Terima kasih.
Thank you to Mrs. Erin Mariloid and Mrs. Prof. Madia Dr. Haliza binti Abdul Rahman for the speech, and Mr. Nurse Ian Solihin that has led the second session. To all speakers and moderator, we want to awarding the certificate of appreciation. Dear ladies and gentlemen, we want to remind you again that certificates will be given to participants who take part in this seminar for at least 5 hours. So stay tuned on this webinar until this webinar ends. Ladies and gentlemen, the next we will show you another success story video of Stikes Pertamedika alumni abroad. Please watch and enjoy the video.
Assalamualaikum warahmatullahi wabarakatuh. Perkenalkan, nama saya Putri. Saya alumni dari Stikes Pertamedika angkatan ke-14. Sejak lulus dari Stikes Pertamedika di tahun 2005, saya sempat bekerja di Rumah Sakit Pertamina Pusat selama 3 tahun. Selanjutnya saya memutuskan untuk melanjutkan studi S1 dan S2 di Fakultas Kesehatan Masyarakat Universitas Indonesia, jurusan Epidemiologi. Saat ini saya bekerja sebagai dosen di Departemen Epidemiologi Fakultas Kesehatan Masyarakat Universitas Indonesia. Sejak tahun 2019, saya berdomisili di Jerman untuk menempuh program doktoral di Fakultas Kedokteran Martin Luther University di kota Halle, Saale, Jerman. Kegiatan saya saat ini
berfokus pada penelitian epidemiologi bersama teman-teman PhD kandidat di grup infectious disease. Selain itu, saya juga mendalami metodologi penelitian melalui conference dan course di beberapa uni di Eropa dan sekitarnya. Selain meraih gelar doktor di bidang epidemiologi, saya berharap agar ilmu yang saya terima dapat diaplikasikan di negeri tercinta Indonesia dan bermanfaat bagi banyak insan. Banyak sekali bekal yang saya terima selama pendidikan di Stikes Pertamedika. Di antaranya kedisiplinan, cara bersikap, bagaimana menjalani peran dengan baik, dan masih banyak lagi. Keilmuan yang saya dapat di keperawatan pun ternyata bisa diimplementasikan secara luas. Contohnya seperti sekarang. Walaupun major keilmuan saya saat ini di bidang epidemiologi, tetapi ilmu-ilmu yang diberikan para dosen di Stikes Pertamedika tetap bermanfaat dan bisa saya implementasikan di bidang keilmuan ini, baik untuk kegiatan penelitian, pengajaran, dan pengabdian masyarakat. Di Stikes Pertamedika lah saya diajarkan bagaimana pertama kali melakukan penyuluhan langsung ke masyarakat, bagaimana berkomunikasi dengan baik dengan pasien dan masyarakat, dan bagaimana memanajemen waktu dengan tepat. Secara pribadi, saya dapat menyimpulkan bahwa Stikes Pertamedika tidak hanya mencetak perawat-perawat handal, tetapi juga mencetak insan-insan berguna yang dapat dihandalkan untuk kemajuan kesehatan di Indonesia dan dunia. Buat adik-adik di Stikes Pertamedika, tetap semangat, tetap berjuang, kerahkan kekuatan kalian semaksimal mungkin untuk menggapai cita-cita, dan percayalah bahwa Stikes Pertamedika adalah pilihan yang tepat untuk mengembangkan dan melebarkan sayap-sayap kalian. Terima kasih. Wassalamualaikum warahmatullahi wabarakatuh.
Di tengah keadaan modern yang berkembang begitu pesat, terlintas asa dan mimpi. Akan seperti apa diri di masa mendatang? Akankah diri ini meraih karir impian, menjadi pribadi mandiri yang produktif, dan dapat mengabdikan diri untuk bangsa dan negara? Yang pasti, amanah cita luhur bangsa untuk menjadi sosok yang memiliki nilai profesionalisme, handal, peduli, dan tanggap dengan keadaan adalah sebuah nilai yang harus terus membumi dan menjadi bagian dari pemuda penerus bangsa Indonesia. Stikes Pertamedika senantiasa menjadi pemeran utama dalam dunia kesehatan dan keperawatan. Tidak hanya memberikan harapan dan mimpi, tetapi juga memberikan bukti nyata untuk mendorong terciptanya para perawat unggul yang modern, humanis, dan profesional. Dengan akses strategis yang berlokasi di Jakarta Selatan, Stikes Pertamedika hadir bersama masyarakat. Berdiri sejak tahun 1989 dengan nama awal Akademi Keperawatan Pertamina, berkembang menjadi Stikes Pertamedika, merupakan sekolah tinggi ilmu kesehatan unggulan yang berafiliasi di bawah naungan Yayasan Pendidikan Pertamedika dan PT Pertamedika IHC. Stikes Pertamedika hadir berkontribusi dan berkomitmen untuk mencetak tenaga kesehatan yang handal melalui program studi unggulan yang dimiliki seperti D3 Keperawatan, S1 Keperawatan, Profesi Nurse, S1 Gizi, dan D3 Teknik Radiodiagnostik dan Radioterapi. sebagai sekolah tinggi ilmu kesehatan yang terakreditasi baik sekali dari LAM PTKes, Stikes Pertamedica memiliki sejumlah sarana prasarana yang digunakan untuk menunjang pembelajaran dan memberikan kesempatan bagi mahasiswa dan mahasiswi untuk bisa bereksplorasi, belajar mandiri, dan mengimplementasikan materi yang dipelajari. Di antaranya, mini hospital, ruang kelas, lapangan, aula, laboratorium CBT, perpustakaan, lab gizi, lab TRR, dan vertical garden. Stikes Pertamedica dilengkapi dengan lahan praktikum untuk praktik kerja yang terkoneksi langsung dengan Rumah Sakit Pusat Pertamina, Rumah Sakit Pertamedica IHC lainnya, lahan praktikum jiwa, dan lahan praktikum komunitas. Melalui suasana lingkungan yang hijau, modern, dan harmonis, Stikes Pertamedica berkomitmen untuk selalu memberikan pembelajaran yang holistik sehingga dapat membentuk tenaga kesehatan yang kompeten. Memberikan kebebasan untuk tetap menyalurkan bakat melalui ekskul seperti futsal, voli, taekwondo, saman, dan paduan suara. Stikes Pertamedica memiliki mitra kerjasama dengan RS Pusat Pertamina, RS Premier Group, RS Jantung dan Pembuluh Darah Harapan Kita, RS Dr. Suyoto, RS IMC Group, dan lain-lain. Sehingga memudahkan alumni kami untuk bekerja di dalam negeri maupun di luar negeri. Menjadi bukti, Stikes Pertamedica memiliki keunggulan kualitas dan siap menjadi tempat terbentuknya generasi penerus bangsa. Kini saatnya kamu yang ikut andil menjadi bagian terbaik dari generasi penerus bangsa yang memiliki jiwa profesionalisme, handal, peduli, dan tanggap dengan keadaan bersama. Stikes Pertamedica untuk kebaikan masa depan kesehatan Indonesia.
You can hold my hand, don't be afraid, you're not alone, though it seems that way. I know that time is ticking by, and you've been missing home, but you don't believe in miracles. Who knows what life brings? Things could be getting little heavy. It makes you feel weary, and time is slow. I can't control, but I promise you I'll give you mine. For some people, what makes one a hero is to save the world from evil masterminds. Though I'd love an invincible shield, it's enough to be patient and kind. I'm not super, but I promise I'll try. When you feel pain and the darkness settles, I'll brave the rain, fight through this battle, and I'll be here through thick and thin. You grow a little stronger, you feel a little better, and time is slow. I can't control, but I promise you I'll give you mine. For me,
Perawat adalah salah satu profesi yang luar biasa. Kami sangat mengagumi semangat menolong dan membantu orang lain, khususnya yang sedang sakit oleh para perawat, yang dilakukan dengan tulus dan ikhlas. Terima kasih kami atas pekerjaan yang sahabat-sahabat perawat lakukan selama ini. Kami berterima kasih dan sangat menghormati rekan-rekan perawat dimanapun kalian berada. Kami juga bangga dengan para calon perawat yang dengan sungguh-sungguh belajar untuk menjadi perawat yang handal dan profesional. Selamat Hari Perawat Internasional.
Untuk perawat sedunia, saya mengucapkan selamat memperingati Hari Perawat Internasional. Tetap semangat dalam mengabdi dan bertugas demi wujudkan bangsa yang sehat.
Selamat Hari Perawat Internasional.
Perawat kami masa depan kami. Selamat Hari Perawat Internasional. Perawat kami masa depan kami. Hari Perawat Internasional. Perawat kami masa depan kami.
Selamat Hari Perawat Internasional. Perawat kami masa depan kami.
Kami mengucapkan
Selamat Hari Perawat Internasional. Perawat kami masa depan kami.
Kami, dosen Psikis Pertamedika, mengucapkan selamat Hari Perawat Internasional. Perawat kami masa depan kami.
Dari Prodi Gizi mengucapkan selamat Hari Perawat Internasional. Kami mengucapkan selamat Hari Perawat Internasional. Perawat kami masa depan kami. Selamat Hari Perawat Internasional. Perawat kami masa depan kami.
Selamat Hari Perawat Internasional. Perawat kami masa depan kami.
Kami, BEM Psikis Pertamedika mengucapkan selamat Hari Perawat Internasional. Perawat kami masa depan kami.
Selamat Hari Perawat Internasional. Perawat kami masa depan kami. Selamat Hari Perawat Internasional. Perawat kami masa depan kami.
That's enough of a hero in your eyes.
Okay, thank you to all the speakers that's still on our Zoom meeting room. Dear happy audiences, for the third panel session, we invite our speakers to attend. Please welcome Your Excellency, Mr. Dr. Asep Saifuddin, SHMM, CRP CHRA, Mrs. Nur Mahyati, SOS Eskepmas, and Mr. Tukimin Samsuito, Bachelor Science Education, Bachelor Science Nursing, Magister Public Health, Magister Science of Nursing, PhD, which will be guided by our moderator, Mrs. Nurse Diana Rismawati Jupri, SGUP, MGUP, SPKMB. Before the moderator take over the session, let me read the moderator CV. Her name is Mrs. Nurse Diana Rismawati Jupri. She was born on Surabaya 5 December 1980 and she lived at Cluster Baiti Janati, Cipondoh, Tangerang. She worked at Psikis Pertamedika as a lecturer and she is a head of program study of nursing bachelor degree Psikis Pertamedika. She graduated from Nursing Diploma of Pertamina Nursing Academy, Bachelor of Nursing of Psikis Pertamedika, Magister of Nursing and Medical Surgical Nursing Specialist from Faculty of Nursing Indonesian University. She has also conducted a lot of research according for her expertise during 2019 until 2022. Ladies and gentlemen, please welcome Mrs. Nurse Diana Rismawati Jupri, SGUP, MGUP, SPKMB.
Thank you, Mrs. Rani Rahmasani Tanuwijaya MGZ. Assalamualaikum warahmatullahi wabarakatuh. Good morning and welcome to today's seminar about becoming professional health worker abroad. The Honorable Mrs. Dr. Gigi Miradia Wahyuni Mars, President Director of Pertamedica, IHC, as keynote speaker, and Mr. Dr. Harif Fadilah, SKP, SHMH, MKEP, as the Chairman of Indonesian National Nurses Association. Let me introduce myself. My name is Nurse Diana Rismawati Jupri, Magister Nursing, Specialist Medical Surgical Nursing, and I'll be your moderator for today's discussion for the third panel session. Before we start, let me quickly go over today's agenda. We'll begin with a brief introduction of our guest speaker, followed by their presentation. First topic is Green Human Resources Management to Increasing Quality Services in Hospital, which is presentation by Mr. Dr. Asep Saifuddin, SHMM CHRP CHRA, as CEO Pertamedica Educational Foundation. The second topic is optimization of Pertamedica Health Science Institute towards international recognition, which is presentation by Mrs. Nurse Mariati, SOS SKEP Mars, as Chairman Stikes Pertamedica. And the third topic is educational institution in preparing graduates to work abroad, which is presentation by Mr. Tukimin Binsan Susuwito, Bachelor Education, Bachelor Nursing, MPH, MSc, Nursing PhD from Lincoln University College, Malaysia. As participant, you are encouraged to ask questions by fill in the link question and answer in the chat box. Thank you for your participation. Now, it's time to hear from our first speaker, Mr. Dr. Asep Saifuddin, SHMM CHRP CHRA. He was born at Jakarta, 1st July 1969. He has graduated from doctoral program from Mercu Buana University, Jakarta, and many journals has published. He is CEO Pertamedica Educational Foundation from 2019 until now. And he is here today to share his expertise with us. Without further ado, I'll hand it over to Mr. Dr. Asep Saifuddin, SHMM CHRP CHRA, for the presentation. We will give you 20 minutes for presentation. To Mr. Dr. Asep Saifuddin, SHMM CHRP CHRA, the time is yours. Please.
Can you hear my voice clearly?
Yes, clear.
Okay. It will be better for me and us to know that's my voice, well, presentation clears enough. So the points will be delivered correctly. If there are no technical issue, let me start this agenda again with greetings to all audience. Assalamualaikum warahmatullahi wabarakatuh, and good afternoon, everyone.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you, Ibu Diana Rismawati, as a moderator. Our guest of honor, Ibu Dr. Gigi Miradia Wahyuni Mars, CEO, President Director of Pertamedica IHC, as the keynote speaker at this three-continent international webinar. Thank you, Ibu Mira, for your support and guidance as Chief of the Board of Trustee Pertamedica Foundation. We also Honorable Dr. Harif Fadilah, SKP MKEP, as a Chairman of the Indonesian National Nurses Association, and all speakers. Honorable members of the Board Pertamedica Foundation, and Ibu Nurse Mariati SOS SKEP Mars, as the Chairperson Stikes Pertamedica, the Vice Chairpersons, the Organizing Committee,
and the entire academic community of the Stikers Pertamedika. I'm proud of all participants in the Three Continent International webinar, ladies and gentlemen. First, I would like to thank the organizer for the opportunity. It is an honor for me to present a presentation entitled Green Human Resources Management to Increase Quality Services in Hospitals. The Green Human Resources Management theme is exciting and has become a global issue and is being discussed by researchers in several recent journals. The presentation that I will present on this occasion will be divided into several discussions. The first is introduction, literature review, research method, result and discussion, conclusion, implication, limitation and suggestion, and lastly, we also attach a reference. Can you show the presentation, please?
Okay, please wait.
Okay, this is my presentation, Green Human Resources Management to Increase Quality Services in the Hospitals. Next. This is my curriculum vitae. I was born in Jakarta on July 1st, 1969, and completed undergraduate education at the Faculty of Law, University of Indonesia, economic specialization, and then graduated from summa cum laude Master Management in Human Resources from Budi Luhur University, and Doctor in Human Resources title obtained from Mercu Buana University. And I have a Certificate Human Resources Professional designation was obtained from the Atmajaya University, and Certified Human Resources Analysis from the American Academy of Management USA. Some positions include Manager of Industrial Relations and Welfare of Pertamedika, Corporate Secretary of Pertamedika, Vice President of Human Capital and General Affairs Pertamedika, Technical Expert and Strategic Advisor of Pertamedika IHE, and then the last Chairman of the Pertamedika Education Foundation. This is the seminar conference attended included Tekyo International Summer School of Healthcare Management, Tekyo University Graduate School of Public Health Japan, and etc. Next. This is my publication. Okay, next. This is the contents, introduction, literature review, research methods, results and discussion, conclusion, implication, limitation and suggestion, and reference. Next. As an introduction, hospital face essential and urgent environmental problems. Asmal M. et al. 2014. Health safety and security environment, implementation in hospitals, cannot be carried out because the safety culture has not taken root in society. From Suta Wijaya and Nawangsari, 2018. Hospital can contaminate the environment and are vehicles for disease transmission. Resources from Alam Syahbi, 2007. One of the reasons why Indonesian citizens seek treatment abroad, resources from PricewaterhouseCoopers Strategy 2019. Hospital in Indonesia should have implemented a green hospital, Putri 2016. Effort to preserve ecosystems and natural resources for the future generation, from Howard Grenfell et al. 2014. And green human resources management as a human resources aspect of environmental management, Renvix et al. 2013. Next. We also see several phenomena that occur mainly in Indonesia, such as many cases of work accidents, contracting disease, and contracting HIV/AIDS, resources by employment research in the health sector, 2017. And then the increase in medical loss almost during the COVID-19 pandemic increases 5 times, AGES 2020. Hospital service quality is not optimal. Report on Community Satisfaction Index survey of the Indonesian Ministry of Health 2017. Malaysia and Singapore derive more than 50% of their total healthcare revenue from Indonesia due to service quality. PricewaterhouseCoopers Strategy Analysis 2019. Next. Based on several phenomena, green human resource management is an emerging concept that integrating environmental concern into human resources management in organization. It involves adopting environmentally friendly practices and policy that promote sustainable development. On the other hand, hospitals are one of the largest energy consumers and produce significant waste. Therefore, integrating green human resources practices in hospital can help reduce their environmental impact while improving service quality. Therefore, this presentation explored this concept of the green human resources management and its role in increasing the quality of services in hospital. Next. In the literature review, several experts and researchers have formulated definition and understandings of green human resources, such as human resources, which are known as the most significant assets in a company, are considered able to integrate all activity to achieve positive performance. Rawasde and Al-Adwan, 2012. From Opata and Arul Rajah, 2014, green human resources refers to policies, practices, and systems that make organizational employees environmentally friendly to benefit individuals, society, the natural environment, and the business environment. From Mishra, 2017, green human resources management definition is also an implementation through to the process of planning, HR recruitment and selection, training and development, and compensation and appraisal to maintain environmentally friendly goals. Watson and Cafitt, 2014, make a definition for green human resources management is a set of policies, practices, and strategies related to human resources disciplines that can ensure the achievement of an overall sustainability business model within an organization. Green human resources management is a relevant phenomenon to recognize the link between organizational action and that affect the environment, change, design, implementation, and impacts of human resources system. From Provaznek et al., 2017. Green human resources management is also significant for company to socialize environmental issue and connect to human resources policy and practices. Bombiak E. and Anna N.K. 2018. Next. From Opata and Aduraja on International Journal on 2014, describe an understanding of green or greening, which has at least four versions, namely conservation of the natural environment. Second, meaning avoidance or minimization of environmental pollution. Third, meaning generation of gardens and looking like natural places. And then meaning preservation of the natural environment. Next. Regarding service quality, I quote several definitions from several experts as follows. Quality is an abstract concept that makes it difficult to measure and is currently viewed from multiple perspectives. Lee et al. 20,000. A service quality approach can determine company success in providing quality services. Parasuraman et al. 1991. Service quality meaning is a customer's perception of whether the service is good or bad. This compare the service customer expect to get and what they understand. When the former is subtracted from the latter and the difference is more significant than zero, the customer quality of services is ideal or satisfactory. Resource from Cheng 2013. Healthcare services quality meaning is the application of medical science and technology in a manner that maximizes its benefit to health without correspondingly increasing the risk. Donabedian 1980. And the meaning healthcare service quality is doing the right things and making continuous improvements, obtaining the best possible clinical outcome, satisfying all customers, retaining talented staff, and maintaining sound financial performance. Resource from Libov et al. 23. Next. Next. Research method. The research was conducted in middle August 2020, which has still a COVID-19 pandemic situation. The questionnaire used a Likert scale of 1 to 5 with ratings of strongly disagree, disagree, neutral, agree, and strongly agree. This research used the data analysis method with the variant-based structural equation modeling technique using SMART PLS, partial least square, software and computer media. This research was conducted at 19 Pertamedika IHE state-owned hospital with different classes spread in various city and province in Indonesia. Next. We also describe how the organizing framework for green human resources research is quite from Ren Shenrong and friends in the years 2018. From this figure, it can be seen that studies related to green human resources are influenced by external environments, such as sources of pressure, sources of guidance, and sources of awareness. And the international environment with antecedents organization level, like leadership, strategy, structure, technology, reporting practices, and the employee level, such as EM knowledge, conscientiousness, moral reflectionist, green experience, demographic attributes, and then making a green human resources management system, like recruiting, selecting, training, development, performance measure, compensation, career advancement, employee involvement, empowerment, work-life balance, and employee relation. With the mediators as like organization level as an opportunity for green behavior and collective attitude. For the team level, with the knowledge sharing, green advocacy, leadership, and the employee level, like a perception of green human resource management, competency, self-regulation, and motivation. As the moderator, employee level or organization level. Next. For research conducted based on research methods that have been set at 19 hospitals in Pertamedika IHE environment. First, look at the population at that time with number 6,619 people, where the minimum sample of the population is 5% of the total number of workers. So that the number 330.95, which is then rounded up to 331 people. Okay, next. You can see the result from the research. So this is the result of research received based on several respondent profiles from 19 Pertamedika IHE hospitals, such as based on island location, based on department, installation, profession, based on position, gender, age, education level, years of service, and worker status. Other things, data from respondents also included the location of their health services and their experience of getting inpatient and outpatient services. Okay, next. On this page, we see that from the feedback from the respondents, we also see how each hospital gave the respondents. The hospital gave significant response and cooperation in this research. Next. Okay, next. No. Okay. On this page, we see the response rate in this study, which is quite large, with the number of valid response reaching 1,004 of the form distributed as many as 2,251. Thus, the response rate of 45.6% with 1,004 respondents in this research questionnaire is statistically acceptable. The return rate of 40% is considered very satisfactory, and the number of 1,004 respondents is large compared to previous hospital studies. Compared with the number of respondents in previously conducted health research, the result of the study were among the largest at the time. You can see, like Shafiq et al. In Pakistan, they have 340 respondents. Yesliada and Director on Cyprus, they have 806 respondents. So this is the result of this study, were among the largest from hospital in IHC. Next. Okay. Several essential things can be noted from the results of respondents who answered the questionnaire, such as a total of 1,004 respondents have become respondents to this survey. Based on the origin of the state-owned enterprise hospital, the largest number of respondents come from Pertamina Balikpapan Hospital, namely 151 people, or 15.84%. And the lowest participant rate was Pertamina Balongan Hospital, 12 people, or the equivalent of 1.20%. Based on gender, the number of female respondents who participated in this study was 635 respondents, or the equivalence of 63.2%. In contrast, the male respondents were 369 people, or equivalent to 36.8%. Based on the result of the descriptive analysis of the age of the respondents, it was found that the majority of respondents were aged between 31 to 40 years of 401 respondents, or 39.9%, followed by those aged between 20 to 30 years of 274 respondents, or 27.3%. And then age 40 to 50 years, as many as 270 respondents, or 26.9%. The lowest remaining respondents are aged more than 50 years, as many as 59 people, or 5.9%. Next. Discussion of green human resource management indicators. 9 indicators have a significant positive effect on the green human resources management variable, with the most significant contributor shown by the green competence building dimension, with the environmental training indicator being a priority compared to the other types of training. At the same time, the lowest effect is the green employee involvement dimension, with the indicator manager maintaining open communication with employees about environmental issues. Discussion about green human resources management indicator. Of the 26 indicators of the variable service quality, it has a significant positive effect on the variable, with the largest contributor indicated by the indicator of the level of feeling that nurses will not make mistakes. All the same times, the small show a polite employee attitude. Next. The link between implementing green human resources management policies and practices lies in the importance of service quality that can provide customer satisfaction. Most service sectors have linked human resources strategy with human resources practices to reinvent customer services activity to achieve customer satisfaction. Human resources strategies and procedures, including practices in the service sector, can support service quality. The application of green human resources practices developed over several decades answer the question that the management of green human resources is suitable for improving service quality. Effectively, by managing human resources, service companies can develop the types of employee behavior that are important for the success of the company's competitive strategy, especially when providing service quality to their customer. Some selected human resources practices, such as workplace support, training, reward system, and performance appraisal, will also be closely related and affect service quality. Implementing green human resources management practices and policies identified by management is essential for the strategy success and the influence of employee commitment and competence so that it can positively influence service quality. Next. Adopting green human resources management practices in hospital can have several benefits, including first, cost reduction. Green human resources management practices can help hospital reduce operating costs and reducing energy consumption and waste generation. For example, energy efficient lighting can reduce electricity bills, while the use of reusable items can reduce the cost of purchasing disposable items. Second, improve reputation. Hospitals that adopt green human resources management practices can improve their reputation by demonstrating their commitment to environmental sustainability. This can enhance the hospital image and attract environmentally conscious patients and staff. Enhance patient care. Green human resources management can improve employee morale and engagement by promoting a culture of sustainability and social responsibility within the organization.
I'm sorry, Dr. Asep. Your time is 5 minutes more.
Thank you. Okay. I can move more faster then. For improve employee, green human resources management can improve employee morale and engagement by promoting a culture and sustainability and social responsibility within the organization. And then sustainability business, green human resources management helps keep company moving forward in sustainable manner. Next. Result and discussion about the energy conservation. Hospital can reduce energy consumption by adopting energy efficiency practices, such as using LED lights, installing motion sensor to control lighting, and using energy efficient IFAC systems. Hospital can also use renewable energy resources, such as solar or wind, to power their facility. Implementing green human resource management in hospital can waste reduction. Waste reduction. Hospital generates significant amounts of the medical and non-medical waste. Green human resource management practices can help reduce waste generation by promoting recycling, composting, and using biodegradable products. Hospital can also implement waste reduction programs, such as reducing the use of disposable items and using reusable items. Green procurement. Hospital can adopt a green procurement policy involving environmentally friendly products and services. Green procurement policy can include eco-friendly cleaning products, biodegradable food containers, and energy-efficient medical equipment. Transportation. Hospital can adopt environmentally friendly transportation practices, such as using hybrid or electric vehicles, promoting carpooling, and providing shuttle services for staff and patient. And employee engagement. Hospital can engage employee in green human resources management practices by providing training environmental issue and encouraging them to participate in environmental initiatives such as recycling programs. Next. So this is the conclusion. Green human resources management can be a powerful tool for hospitals to improve the quality of services they provide while also reducing their environmental impact. Hospitals can save costs, engage employees, and contribute to a more sustainable future by implementing green human resources management practices. Next. This is the implication of the research for hospital management This research will help create policy and models related to environmentally friendly human resources management to improve hospital quality of services by green human resources management. Next. Limitation and suggestion. This is for more in-depth understanding. Further research can examine service quality change due to all stakeholder green human resources management influence over a more extended period. The research population is also limited employee, so service quality is viewed from the self-assessment and supply side perspective. Future research can be carried by across all hospital stakeholders by involving a larger population. Further research can also be carried out in other service industry by adapting this research to different location and culture. And then in the end is the reference. So next. This is the reference. Next. Okay. So this is the end of my presentation. I hope you can get a new insight, a new perspective, a new idea, especially about this theme, green human resources management to increase quality service in hospital. And it will be very great if any audience want to discuss this theme after the closing. That's all for today. Thank you and have a nice day. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Okay, thank you Mr. Dr. Asep Saifuddin SHMM CHRP CHRA for your insightful presentation. I'm sure our audience has learned a lot from you today. Thank you for your participation. Now it's time to hear from our second speaker, Mrs. Nurse Mariati, Esos Eskep Mars. She has graduated from Magister Program from Indonesia University. Many journals has published. She is Chairman Stikes Pertamedika, and she is here today to share her expertise with us. Without further ado, I'll hand it over to Mrs. Nurse Mariati Esos Eskep Mars for the presentation. We will give you 15 minutes for presentation. To Mrs. Nurse Mariati Esos Eskep Mars, the time is yours. Please.
Okay. Thank you, Mrs. Diana as moderator. Can you hear my voice is clearly?
Yes, clear.
Okay, thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good afternoon, ladies and gentlemen. Before I start my session, allow me to greet and give my many thanks to the Honorable Dr. Gigi Miradiah Wahyuni Mars, President Director of Pertamedika IC, is keynote speaker, and Dr. Hari Fadila SKP SHMH MKEP as the Chairman of Indonesian National Nurses Association, and all speakers, as well as all the webinar participants for joining in to learn about optimization of Stikes Pertamedika toward international recognition. Next. Okay, Stikes plays a vital role in producing quality health workers who can compete in the global market. Therefore, to improve the quality of education and attract students from various countries, Stikes need to develop itself into a campus that recognized internationally. Next. Let me start with how to become an internationally recognized campus. Stikes will be able to enhance its image and reputation in education and the global healthy industry. In addition, Stikes will also be able to produce graduates who can compete in the worldwide market and make a more significant contribution to the advancement of the health sector at the international level. Therefore, Stikes needs to continue develop itself and strive to become a campus that that is recognized internationally. To achieve this goal, stickers need to make various efforts, such as improving the quality of facilities and infrastructure, developing curriculum that comply with international standards, and improving the quality of lecturers and students. In carrying out this effort, stickers also require support from various parties, including the government, educational and research institution, and the industrial world. Next. Next slide, please. Okay, stickers Pertamedica that has been around for a long time. It's part of PT Pertamina Bina Medica IC, is the largest holding hospital in Indonesia. Pertamedica IC currently has 78 hospital and 240 polyclinic, which spread throughout Indonesia. Stickers Pertamedica is under Pertamedica Educational Foundation. Next. The steps toward international standard are as follows: obtaining international accreditation, applying international standards, develop international cooperation, holding a student exchange program, improving research and publication quality, applying the latest technology, and improving English. Next. Obtaining international accreditation. The recognition can be done by following the accreditation process established by a recognized international accreditation organization, such as the Accreditation Commission on College of Medicine, Joint Commission International, or the Accreditational Council for Pharmacy Education. Next. Applying international standards. Stickers can apply international standard in the management and delivery of its educational programs. For example, stickers can ensure that their curriculum and teaching method reflect internationally recognized best practice. Next. Develop international cooperation. Stickers can establish cooperation with international education institutions or health organizations to gain international recognition. Stickers can access global resources and expand their professional network through this collaboration. Next. Holding student exchange programs. Stickers Pertamedica can hold student exchange programs with educational institutions abroad. These exchange programs will help broaden students' horizon and knowledge and enhance the campus' international reputation and recognition. Improving research and publication quality. Stickers Pertamedica can improve the quality of its research and publication by publishing its research result in international journals and international conference presentation. This activity will help enhance the campus reputation and strengthen its international recognition. Next. Applying the latest technology. Stickers Pertamedica can apply the latest technology to manage and delivering educational programs. This also coordinates to gain international institution. Improving English. Because English is the primary language in international communication, Stickers Pertamedica can improve the ability of students and staff to speak English. Next. Students' role. Expanding knowledge, curriculum development, improving research quality, organizing academic activities, and participating in international competition. Next. Next slide, please. Expanding knowledge. Students can expand their horizon and knowledge about health education. They are also encouraged to join student exchange programs, international conference, or other academic activities. Next. Curriculum development. Students can provide input and suggestion on curriculum development under international standards. Okay, next. Improving research quality. Students can contribute to improving the quality of research conducted by health science colleges. Organizing academic activities. Students can organize academic activities such as seminars or workshops by inviting international experts in the health sector. Participating in international competition. Students can participate in international competition in the health sector, increasing the quality and recognition of the campus. Next. Next slide. Next slide, please. Next. Okay, can I continue to presentation? Okay, please, next slide. Kalau nggak dari aku. Okay, I'm sorry. I will be continue my presentation. Lectures and teachers role. Sorry. Sorry, Mrs. Diana. Okay. I will to continue my presentation. Okay, lectures and teachers role, developing curriculum, conducting scientific research and publication, improving teaching quality, encouraging participation in international programs, and improving assessment quality. Developing curriculum, lectures can contribute to developing curricula according to international standard, conducting scientific research and publication. Lectures can carry out high-quality research and scientific publication in leading journals in the health sector. Improving teaching quality. Lectures can enhance the quality of teaching by using effective and innovative teaching methods. Encouraging participation in international programs. Lectures can encourage participation in international programs such as student exchange programs, international conference, and other academic activities. Improving assessment quality. Lectures can improve the quality of assessment by using effective and objective assessment method. Government rules. Financial support, improving the quality of teaching staff, improving access to sport resources, and collaborate with international institutions. Alumni and graduates role. Giving feedback, become ambassador in introducing the campus, offering mentorship and support, participating in curriculum development, and providing financial allowance. Giving feedback, alumni can provide feedback on the education and teaching programs they are undertaking. Becoming ambassador in introducing the campus, alumni is campus representatives. They promote the school among family, friends, and colleagues, as well as on social media and other online platforms. Offering mentorship and support. They can share career advice, assist in job search, or provide insight into the healthcare industry. Participating in curriculum development, alumni can provide input on the skills and knowledge needed for success in the health sector and advice on improving academic programs. Providing educational allowance. Alumni can share information, provide scholarship to needy students, or finance research and development in the health sector. Okay, optimization steps, international accreditation, professional recognition, international cooperation, international publication and presentation, and use technology. International accreditation. International accreditation can help STIKAS Pertamedika gain international recognition as educational institution with international standard. Professional recognition. STIKAS Pertamedika can gain international recognition. This accreditation can be fulfilled by ensuring the curriculum follows international. International cooperation. STIKAS Pertamedika can collaborate with educational institution or international health organization to build relationship and gain international recognition. Through this collaboration, seekers can gain access to global resources and expand its professional network, international publication and presentation. Seekers Pertamedika can gain international recognition by publishing its research and research result in international journals and international conference presentation. Use of technology. Seekers Pertamedika can use technology to gain international recognition. Utilizing innovative technology, Seekers Pertamedika provide access to distance learning and online resources accessible to international students and healthcare professionals. In this conclusion, Seekers Pertamedika must be committed to improving the quality of their education and adapting to the latest development in the health sector to build international recognition. In addition, Seekers Pertamedika must actively seek opportunities to collaborate with international institutions and promote themselves as innovative institutions committed to improving public health globally. Thank you. Assalamualaikum warahmatullahi wabarakatuh. Okay. Halo, Miss Diana. Halo, moderator.
Okay, Waalaikumsalam warahmatullahi wabarakatuh. I'm sorry for the trouble. Thank you, Mrs. Nurse Mariati, Esos Eskepmars, for your inspiring presentation. I'm sure our audience has learned a lot from you today. Okay, the last speaker is Mr. Tukimin bin Sansuito, Bachelor Education, Bachelor Nursing MPH MSc, Nursing PhD. He is a senior lecturer from Lincoln University College, Malaysia, from 2016 until now. He has published many journals, and he is here today to share his expertise with us. Without further ado, I'll hand it over to Mr. Tukimin, Bachelor Education, Bachelor Nursing MPH MSc, Nursing PhD for the presentation. We will give you 20 minutes for presentation. To Mr. Tukimin, Bachelor Education, Bachelor Nursing, MPH, MSc, Nursing PhD, the time is yours. Please.
Okay. Thank you for the moderator. Okay. Assalamualaikum warahmatullahi wabarakatuh. Can you hear me?
Your voice is clear.
Okay.
Yes.
Can I share screen or maybe you will share the screen?
Okay, wait a minute.
Okay, while waiting for the PowerPoint, actually I speak here on behalf of Prof. Dr. Bibi Florina Abdullah, Pro Chancellor of Lincoln University College Malaysia, who unable to join and deliver his speech directly because she is on traveling, actually in overseas traveling now, actually on the road. Then only just in overseas, but on the road, therefore cannot be deliver the speech. Actually, she greets all of you then in detail, respected to Dr. Arif Fadila, the Director of Indonesian Nurses Association, then Dr. Asep Saibuddin, CEO Pertamedika Education Foundation, then NS Mariati, Esos Eskepmars, Chairman of the Stikers Pertamedika, then Dr. Gigi Miratwi Wahyuni Mars, the President Director of Pertamedika Healthcare Corporation, then webinar committees, and then speakers, lecturers, students, and all of the participants. Let me to present the PowerPoint that Dr. already prepared. Okay, our topic actually is the educational institution in preparing graduates to work abroad or working in the overseas. Okay, next. When we talk about the overseas job opportunity, next, this slide. Actually, we have to consider the input and the process and the output. Hello, can you go to the next slide? Okay. So, okay, thank you. Okay, yes, because I just on behalf, so I just need to read the PowerPoint and with a small explanation. The background because of the healthcare globalization, include the nurses globalization. Healthcare globalization actually remove the borders and bring system structures and process in the healthcare area closer in all over the world. If we can analyze actually, there are so many patients. There's someone from Indonesia, then come to Malaysia. Reversely, from Malaysia for some time also go to UK. Because of a particular disease. They simply actually because of one effect of the healthcare globalization. Okay, next slide. Okay, healthcare trend. Okay, the firstly actually patient-centered care. In this context, actually one patient will be treated with a multidisciplinary health team, and they basically will need more the healthcare worker or healthcare professional. That is the worldwide trend, not only in Malaysia, but in other countries also. There is one healthcare technologies, such as the digitalization in healthcare, then include the robotic technologies. Actually, we recognize the robotic nurse also today, and not only the robotic, the customer service, but robotic nurse that can. We have to adapt with the new working culture using the technology. And the next one also we recognize some product in healthcare that include the artificial intelligence. There is one. There are healthcare delivery shift. Not only just the nursing delivery model. From functional to team, then to the primary team. But the healthcare delivery shift to include the physical delivery model. To combine and mix with the virtual or online delivery services. Okay, next slide. Actually, there are some trend and issues in the worldwide, to include the global health issues. As we know now that in the last 5 years, the global health issues actually highlight the trend of the disease actually move from the communicable disease to non-communicable disease. However, actually, we have to consider both. It is actually increase the POR in other countries, specifically the countries with the common non-communicable disease, such as diabetes mellitus, they're simple. So we have to consider the global strategies by WHO to control and to combat some disease, include the non-communicable disease. In addition, so we have to consider also the United Nations strategies that previously we recognize as the MDG, Millennium Development Goal, but recently actually sustainable development goal, specifically sustainable development goal 3, about a good health and well-being, and sustainable development goal 4 about the quality of education. So we have to consider the recent issues in the country, including the ASEAN countries, local oversupply, for nurses, specifically for the diploma. So this actually will encourage the nurses after graduated will think and take the alternative role. Because in some cases actually change the professions, then some actually continue to study, then go to abroad. The next one, there's the common issue, the global healthcare issues, the global healthcare worker shortage, the nursing shortage. Actually, this is no new case or the new problem, but we agree that in the worldwide actually still, lack of the nurses specifically, and then healthcare workers in generally. Then we have to consider also the healthcare globalization that actually produces the cross boundaries. Not only talking about our country, but we have to discuss and we have to take part and role. Then we have to consider also to engage the other country. Then we will involve to other country. because in other countries, such as in the Middle East, they're simple. Recognize the Middle East actually one destination, the big destination for health worker migration. Because Indonesia is just simple. There are in Canada, they're simple. Actually, then the most Malaysian actually in Malaysia, specifically actually in the Middle East. And others. It is encourage the healthcare worker migration. When we analyze actually the majority of the nurses in Malaysia actually experience has experience from the other country or from the overseas, specifically Middle East. Okay, next. Next slide. Benefit work abroad, it look amazing in your resume. Actually, look like a trending, look like a better experience. If we has a resume or CV with the overseas experiences, then make a lifelong friends. Because now actually the global era, that normally our children, then our friend also, and only local, but normally also we have the international members, specifically the professional. So you have to involve yourself to participate in the international activities. Then see through a new lens, so we can exchange the experience, so we can see our on the profession based on the at the country perception or perspective, because we will interact professionally with others professional members from other countries. Then we learn a language, specifically English and the local language in the country. For example, if we go to Japan, for example, automatically, not only English, but you will learn also about the Japanese language, including the Arabic. When you go to the Middle East, for example, automatically you will learn the Arabic language. To join the global community, then grow as a person, specifically and economically, work abroad. When we go to overseas, will give you the economical benefit. And then we'll see the world. So we'll see how this country manage the healthcare, and then we interact with the local community in the other countries. And learn what nursing means around the world. Not only in Indonesia, not only in Malaysia, but we can interact. We can learn. We can compare with the other country. Because we know that nursing actually science and art. Scientifically maybe no problem with the worldwide actually same. But when you go to UK, there's when you go to US, there's in Malaysia, Australia, actually there are some difference. According to the policy, according to the common organizational practice. The example such as in Indonesia, the example such as episiotomy, the example. Episiotomy in Indonesia practice, but in UK actually never again they practice. Including in Malaysia. So we can learn from others member from other country. Next slide. Global demand. In reality, when you search in the internet, or maybe you go to the agency, or maybe you experience in some collaboration, actually there is some global demand to the healthcare workers, specifically related to the caregiver. But don't confuse with the term of the caregiver. Because recently actually promoted the caregiver only just the vocational caregivers, such as in New Zealand, example. When you search the internet, there are so many demand. The caregiver, vocational for New Zealand and German. But we normally send the nurses and the healthcare workers actually professional health workers. I mean, I just know I mentioned about the vocational, the example. The senior high school student, the example, then with additional 6-month training, the example, for basic care, the example, such as vital sign measurement and others. So sometimes can go to other country and become caregiver. But the target actually is the only vocational, not professional. But actually, when we talk about go abroad, nurses should be professional caregiver, or in this context, actually direct player nurse. Then many of our nurses actually in overseas become the nurse educator. Nurse educator. It is actually one common of the nurse role in the worldwide. The nurse manager, I mean the senior nurse when you go to overseas, so you can apply as manager. Then home care nurse, then hospice nurse. Hospice nurse actually a little bit different. Hospice actually nurses actually care, comfort there, and increase the quality of life for the patient. Normally, patient with a very serious illness. Then school health nurse, then occupational health nurse, then public health nurse, then epidemiologist. Nurse in this context, epidemiologist is the common demand from the public and the worldwide actually, and the quality. I mean, the infection control. The infection control nurse. Then for the extended role such as a researcher, this actually will need the advance. We need the additional skills. And then the next one actually advanced practitioners. This also will need the additional education. I mean specifically you can take the master. The example will become the advanced the practitioners. Include the clinical nurse specialists. Actually in Malaysia or in other countries we recognize the term the advanced diploma. Maybe in Indonesia you recognize the D4, D4, example they actually can be considered when you learn about the practice, so consider the clinical nurse practice. The example in pediatric, in geriatric, in the mental health nurse and others. Next slide. Okay. Preparation info fair when we want to send nurses to the overseas. So there are three component important. The info fair in preparation. The firstly is education institution. Actually, the role of the educational institution actually to educate. To educate until the student is graduated as the nurse, and then educational institution actually responsible. They are responsible to success the nurse registration because of the finish their study. So the educational institution will facilitate the nurses to register in nursing board. They normally actually register, the nursing board exam. Then after finish, after complete, then pass will become the registered nurse. Actually, there are responsibilities. So there is one the agencies and employers. Hello, can I continue? Agencies and employers. So this actually they normally commonly send directly the nurses. For example, in Malaysia, such Melorita, the example after student, after graduate. Okay. So how to work abroad? As a nurse. So and your nursing degree or higher, because the requirement to register nursing board actually the first degree or maybe the after diploma. This is very important. Yes, be registered there in the nursing board also. Maybe in Indonesia, actually in Indonesian Nurses Association. So after finish the degree, so we have to pass the nursing board exam. And nursing board exam is actually the responsibility, the responsibility of the nursing education institution. The number one. There is one after student pass from the nursing board actually normally will apply to get the job in the local. So gain experience in nursing. For example, working in the hospital, working in the public health center, the example and others. Then it's very important to add with another skills. The simple we can take the short course or maybe the the specialization. Just now the advanced diploma, the simple. So pursue other credential. Before apply to agency or maybe direct apply to the employer. However, actually, there are some education institution actually has a particular collaboration with the job recruitment or maybe directly with the hospital. Actually, the example, our previous student here, actually, we have some collaboration with Singapore, Singaporean hospital. Actually, before student graduated, actually the Singaporean HR come to our institution, then go interview, and then close contact with the university. And then after graduated, actually directly the student call by the hospital and then start work as the nurse. But commonly actually the hospital in the overseas actually request for the experienced nurse, only in the small number. Actually they take care of the fresh graduate, postgraduate student. Then apply directly or through the agency or direct, and then the next step actually some agent actually provide the training, then prepare exam. But in Malaysia normally just only interview normally. But in Indonesia, I know that actually normally will start with the training and then prepare exam, then interview, and then after that they register to the destination country and nursing board, and then we continue the calling visa and the placement in the country destination. Next. Okay, next slide. That is the institution responsibility. Okay, educational institution, actually the role, it is important as the systematic transmission to transmit the knowledge, skill, professional and cultural values within the formal organized structure. Next. Why study in Malaysia? This may be the consideration. Why the people from other country choose Malaysia as the study destination? Because quality education in Malaysia was recognized globally. You can search. So the Malaysian, graduated student actually distribute in work in other country. Recently, like. My student also in overseas, actually the active student, actually in Saudi or in Oman, is simple, in Middle East, in Medina, in Makkah, actually from Singapore, actually, and there are a lot of students from those countries, because recognized globally. There is one affordability, the study and living costs. Actually, we compare with other countries in Asia countries or maybe Western countries. Actually, the Malaysian living costs and the study fees actually more affordable. Include the actually accessibility because the geographical proximity actually near. Actually Malaysia is near. If you compare with the other countries, then because recently the chosen why we study in Malaysia, actually people who study in Malaysia actually still can maintain their job, and then can have and maintain the interaction with the family, actually without leave the family. Because specifically for postgraduate study, actually we provide study by research. In culture and linguistic similarities and then the geographical proximity, because the Malaysia actually in the South Asian countries, so consider still nearby or close with Indonesia specifically. Then it's one diversity. Actually, Malaysia was recognized as the multicultural countries. The population also we recognize as the international population. And therefore, the university in Malaysia actually look like a home. For the international student from overall of the worldwide. Okay, next. It is very important for institution to set visionary, the university. The example, our vision to be an acclaimed institution of higher learning that provide world-class education with high capability in providing knowledgeable and skillful professional to serve the global society. If we want to set our outcome globally. So we have to set the vision of our college, our university, or our stickers. Because actually everything just follow through the vision and mission. Okay, next slide. There is one we have to set also the mission of the institution to make clearly our objective of the institution. The example to become a truly global university with risk-based approach that enhance lifelong learning opportunities, practical and scientific scientific skills, social values, leadership and entrepreneurship by harnessing information technology to create a noble human society. Next slide. Okay, this is actually similar or same wise with what just now I mean the chairman the chairman of the stickers actually. It is very important. We have to increase our recognition and accreditation. I mean locally, as in Malaysia, the example, the FA program should be registered and accredited by the Ministry of Education Malaysia, then MQA, and then internationally. So we have to involve some particular program, related program, the example program from the WHO, the example program from the UN. So we have to take part, to become the recognized university, internationally and locally. Okay, next slide.
I'm
Okay.
sorry, sir. Your time is 5 minutes more.
Okay, faster. Okay, local achievement. So we have to increase our local achievement. We have to maximize. In Malaysia, actually Setara, Setara actually like our university actually got Setara 5. So maybe in Indonesia, so you have to just follow through the system education in Indonesia. Okay, next slide. Okay, international achievement actually very important to be increased annually. This is really our global range, so we have to improve. I mean yearly. Lincoln example actually now actually under 30 35 under quality of education delivery by time high education. So we have to accredit it internationally also. Then we have to collaborate internationally also. Okay, next slide. Okay, this is still international achievement. So we have to increase. We have to highlight international achievement. So we have to exist internationally to become, I mean, recognized. Include the national publication. Simple. If possible, we have to create the journal and the international journal and publish it the international journal. Okay, next slide. Okay, and this international achievement example, you have to engage your student example to I mean put your university in the global list. The student the example for the student mobility. Okay, next slide. Okay, their paradigm shift actually. Today the study actually not just only full course study. Actually the mixed study is common, including in Malaysia, in Indonesia, but recently actually become a new trend. Actually the postgraduate by research. They actually one choice. The mode of delivery actually not only just ordinary class interaction, but recently actually commonly it's university deliver or provide the blended learning. This may be one special specifically since the COVID-19 pandemic. Actually ODL online distance learning. The learning that actually the modern trend. That engage the self-direction, the experiential learning, and others. And so we have to consider the SIPO model. You want to build your output, not the simple your output. Actually, when producing the student to work abroad or other countries, so you have to consider the input because the output and the outcome are very depend on the input. If you expect the international output, so you have to engage the international input. Okay, next slide. Because the time, and the outcome. So we have to increase also the improvement quality not a status but quality actually is a never ending improvement for the for the institution. Additional preparation is actually considered as the traditional preparation. And so in Malaysia, actually, we serve the student with the outcome-based curriculum. Yeah, if your outcome, you want your student go abroad there as a nurse, simple. So we have to set in our curriculum. Yeah, there is one additional English as a teaching learning medium. Yeah, then subject of English for nurses is actually additional because English actually not our mother tongue language. Yeah, in some cases actually specifically in Indonesia normally will need the additional English for nurses. Yeah, in Malaysia actually the English actually become a normal teaching learning medium already. Yeah, however, some book we have to expose to student also. There is one additional course preparation. Okay, next. Yeah, it is very important to build the collaboration. Yeah, international collaboration with other country. Yeah, who able to recruit the student. In some cases also very important. Yeah, that international clinical internship and the recruitment is really common trend also. Yeah, since before COVID-19 pandemic, yeah, we send the student example in Australia, simple for internship. Yeah, then after that, actually the hospital will recruit the student and continue education also. Yeah, then it's very important because recently it's really considered as the global era, so we have to expose our student international exposure. It's very important to introduce the international standardized practices specifically for the healthcare workers. Include some cases also will need the attachment. Example, you send the student to Malaysia for a few weeks or maybe a few months. Yeah, because now actually in Indonesia I know they actually has the program the Campus Merdeka. The Campus Merdeka actually you can do the attachment. You can do the international exposure. You can get the experience from others countries. Next. Okay, thank you. That's all.
Okay. Thank you, Mr. Tukimin, Bachelor Education, Bachelor Nursing, MPH, MSc Nursing, PhD, for your inspiring presentation. I'm sure our audience has learned a lot from you today. Now it's time to discussing. Okay, the question is, is there any question from audience? You can write your question, fill in the question and answer at the chat box. Oh, okay. Oh, there's so many questions. Question number 1. For Mr. Dr. Tukimin, the third speaker. The question is from Musa, student of STIKES Pertamedika. What are the standards that nurses must have to work abroad? Please, Dr. Tukimin, to answer that question. What are the standards that nurses must have to work abroad?
Can you repeat the question? What requirement? Hello. What is the question? Is it asking about the requirement for work overseas? Hello. Can you hear me?
Okay. Please repeat your answer, please. The question is, what are the standards that nurses must have to work abroad?
Okay, standard. Okay. When we talk about the standard, actually, the education, the institutional education, just follow through the standardized in the country first, locally. Example in Malaysia, actually, the education in Malaysia controlled by the higher education ministry in Malaysia. That's simple. So we have to follow through the standard simple curriculum. Then we have to consider also the policy produced by the professional body, maybe in Malaysia. In Malaysia, actually, nursing board, the example for education, because nursing board actually also put the standard, include the standard intake. Intake mean the requirement intakes, jadi persyaratan masuk, persyaratan masuk the student, the example, and then the process also there has a particular standard, include attendance, lecturers and others, and then include the the curriculum, the curriculum of what is the subject should be included in the curriculum. As simple as just follow the standardized, specifically standardized by the Ministry of Education and the professional body. In Indonesia, maybe the PPNI, actually sorry, that mean Dr. Arif Fadilah, just know, the director of the PPNI. We have to consider PPNI and IPNI, especially in Indonesia. In Malaysia, actually, we have to follow through the policy from the Higher Ministry of Education, then we have to follow the regulation of the MQA, the Malaysian Quality Agency, and the nursing board. Until finish, then so we have to follow through everything that is standardized by the institution. What the institution, example, you study in Pratamedika, so you have to follow through. For the teaching and learning until finish, because the responsibility of the institution actually to process, to process the student then until pass and until graduate. So it is very important that the role of the institution to set out the competency. I mean, if the institution mission actually want to send the student automatically in the curriculum, or maybe in the co-curriculum, or maybe in the elective, so have to include that simple the English, because English actually is not our mother tongue language. So we have to learn extra, to prepare. To prepare that, actually some Indonesian university and colleges, because actually also make a collaboration, for English nurses, nursing, nurses, English for nurses, then and then when practice, in some cases actually can send directly to the hospital and bedside teaching, actually English should be practiced and only just study theoretically. Okay, after that, normally you will get after graduated, so you have to work together. If your institution actually has collaboration, just follow. We have to follow what the institution want. You have to register.
Okay, thank you, Dr. Tukimin, for your answer. I think it's clearly for Musa. Okay, the next question is from Siti, Stikes Pertamedika. What is the role of nurses in GHRM to realize the concept of an environmentally friendly hospital? The question is referred to Dr. Asep. Please, Dr. Asep, to answer the question. Dr. Asep, your voice is still mute.
Who's the question? This question from who?
From Siti, Stikes Pertamedika. The
Okay.
question is.
Siti.
Yes.
Thanks for the good question. This proves there's a concern about the nursing profession. So Green human resources management refers to the integration of environmental sustainability into human resources practices and policy within an organization. Nurses play an important role in green human resources management in healthcare organization, as they are often responsible for the delivery of patient care and ensuring that healthcare practices are sustainable and environmentally responsible. Therefore, nurses have an essential and strategic role in green human resource management to realize the idea of an environmentally friendly hospital. Because nurses are the most numerous professional in hospitals. Compared to the other professions, the number of nurses working in hospitals is always the largest. Besides that, the duties and responsibility of nurses require them to take various actions that directly or indirectly impact medical loss. In the context of green human resources management, nurses can contribute promoting sustainable healthcare practices. Nurses can educate patients, colleagues, and management about the importance of eco-friendly healthcare practices such as reducing waste, using energy efficient equipment, and recycling. Nurse can ensuring compliance with environmental regulation. Nurse can help ensure that healthcare organizations comply with the environmental regulation related to the waste disposal, emissions, and pollution. Nurse can participating in sustainability initiative. Nurse can participate in sustainability party initiative within their organization, such as green teams or committee, to identify area where the organization can reduce its environmental impacts. And then nurse can advocating for sustainable healthcare policy that promote sustainable healthcare practices, such as the use of renewable energy sources, and then the adoption of green building standard. Overall, nurses play a vital role in promoting environmental sustainability in healthcare organization as a hospital. And their contribution to green human resources management can help to create a healthier and more sustainable future for all. I hope this explanation can answer your question. Thank you.
Okay, I think your answer is clear. We go to next question from Rahma, Stikes Pertamedika. What is the government's role in increasing access to the supporting resources needed by tertiary institution, especially Stikes, to become an international standard campus? The question is referred to Nurse Mariati. Please answer that question.
Okay, thank you, Mrs. Diana. Thank you for Rahma. To create in an international standard campus, we really need to the role of the governments. For example, the government can provide facilities such as scientific literature and international journals, databases, and the latest software as well as being a facilitator and in collaboration with educational institutions those abroad. This has also started to be implemented by Higher Education Service Institution, Region 3, namely the DKI Jakarta, which provides assistance to tertiary institution in the DKI Jakarta area to be able to work together with European countries according to the files needed, of course relating to the three Dharma perguruan tinggi, namely education, research, and community service. Thank you, Mrs. Diana.
Okay, thank you for your answer. I think there's so many questions. One for refer to Dr. Tukimin from Via Salamatul Afia, Stikes Pertamedika. The question is, I saw Dr. Tukimin, I am Via from Stikes Pertamedika, student and work in fertility clinic. I am a fertility nurse. Does Malaysia have an association or association of nurses regarding fertility? There is the question.
Yes.
Malaysia have an association of nurses regarding fertility.
Yeah. Actually, in Malaysia, other than the nursing board, actually we have also the Malaysian Nurses Association. Actually, Malaysian Nurses Association. Actually, in the Malaysian Nurses Association, there are some. The smaller component, the smaller component based on the specialties also. Actually, when we talk about the fertility, maybe we talk about maybe in Indonesia related to bidan, Actually, a little bit difference, differ between Indonesia and Malaysia. When we talk about the bidan, because in Malaysia, bidan actually still under nursing board. The board is same with the nursing. Actually, the Malaysian nurses and midwife board actually is still under corridor. Because historically, actually the midwife actually is one specialty in nursing. Consider maybe in Malaysia, in Indonesia, we recognize also the maternity nursing, and so we have to understand it. But there is small difference. Meanwhile, in Indonesia, actually, bidan is the independent profession. They spread from nurses. Actually, recently, then in Indonesia, actually direct entry. Direct entry, start from nurses first. Start from nursing education first, but directly to midwifery education. Therefore, actually, when we talk about the association, actually a little bit different, because bidan in Indonesia actually spread from the nursing automatically will have the midwife or maybe in sub of the midwifery called fertility association. But in Malaysia, actually. The bidan or midwife actually still under nursing corridor. So there is small difference. Actually, we have also the symbol master in midwifery, but they're actually under nursing faculty in Lincoln. But in Indonesia, actually, you have the master in midwifery independently, not master in nursing midwifery. So therefore the association actually little. Actually we have the association, but and the maybe the organizing actually not same. Thank you.
Okay. Thank you, Dr. Tukimin, for your best answer. The next question is refer to Dr. Asep from Alifa Stikes Pertamedika. The question is, what are the challenges And what are the solutions for implementing GHRM in hospitals?
Okay, good question for Alifa. Thank you. One of the main challenge of implementing green human resources management in hospital is a resistance to the change from employee and management. We know both workers and management always want to be in their comfort zone. Therefore, change that must be made in implementing green human resources in all aspects. This will disrupt the comfort of worker and management. They must work hard to adopt the concept that focus on environmental, nature protection, and sustainability development. As you know, green human resources management basically from the grand theory of triple P from the by Eccleston. Eccleston gave the triple P was put forward the company focus in the responsible of the workers and management to achieve. First P is for people, the second P for the first for profit, the second for the people, and the third for the planet. Of course, as a organization and company, profit is a must as a business entity. So all resources can make a profit in the company. The second P or people means that worker internally and externally. People means that worker must be able to develop as a people who came from internally as a worker and externally as a society. Meanwhile, the third P, namely planet, describe the concern of green human resources management to protect our Earth, because Earth is the only planet where human and all living things live and interact. Those current conditions are not good and have even started to worry. As for the solution, of course, it is essential to involve all stakeholders in the process and highlight the benefits of green human resources management in terms of cost savings, improved service quality, and of course, environmental responsibility. Thank you.
Okay, thank you for your best answer. Is there any question? Oh, okay. Next question. I think it's the last question. Refer to Nurse Mariati. The question is, what steps have been or will be taken by Stikes Pertamedika in realizing an international standard tertiary institution? Please.
Okay, thank you, Mrs. Diana. From who, Miss Diana?
Fitri, stickers.
Fitri, okay, thank you. Thank you for Fitri, the good question. In order to achieve international standard, Stikes Pertamedika has taken steps like improving the ability to student and lecturers to speak English. Stikes Pertamedika collaborate with NEC to improve student and lecturers through course. Improve facilities and infrastructure to support teaching and learning activities and other activities according to student need. And improving the quality of lecture by increasing the level of higher education, such as doctoral or doctoral levels through scholarship or independently. Increasing international cooperation, for example, scientific research collaboration, international journal publication, student and lecture exchange and cooperation in other scientific meetings such as today's webinar. Providing assistance to students according to their interest and talent and participating in competition at national and international level. Thank you, Mrs. Diana.
Okay, thank you, Mrs. Mariati, for your best answer. Okay, we have heard from 3 amazing speakers who have given us different perspectives and insight on the topic. Yeah. I think based on the time, it's already finished for us to discussion for this time. Thank you all for your participation and engagement in today's seminar. We hope you found this seminar informative and useful. Valuable knowledge and inspiration from our speaker, and we look forward to seeing you at our next event. I'd like to thank to all speakers for your best explained presentation for today. I'm Diana Rismawati Jupri as your moderator, saying goodbye from this event. Thank you for your attention and have a great day. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Thank you to Mr. Dr. Asep Saifuddin SHMNC RBCRA, Mrs. Narsmariati SOS Eskepmas, and Mr. Tugimin Sansuito for the speech, and Mrs. Nurse Diana Rismawati Jupri SKEP, MKEP, SKI, SPKMB that has led the third session. To all the speakers and moderator, we want to award the certificate of appreciation. Finally, we come to the end session. We will to take up virtual picture together, and we invite all speakers and participants to activate the camera and give the best poses. Okay, operator, get ready. We will start for the first slide. 1, 2, 3. Okay, the next slide. 1, 2, 3. And then the last slide. 1, 2, 3. Thank you. Dear audiences, with the end of the photo session, the international webinar is also ended. Thank you for your participation of this webinar, and thanks to the speakers, and of course thanks to all the committee who worked hard in preparing the international webinar of 3 continents, which is a series of activities for the 34th Disnatalis of Stikes Pertamedika. I am Rani Rahmasari Tanuwijaya as your master of ceremony, saying goodbye from this event. Thank you for your attention and see you on our next webinar international. Wassalamualaikum warahmatullahi wabarakatuh. See you.
Waalaikumsalam
warahmatullahi wabarakatuh. Thank you, Mr. Tukimin.
Thank you.
Aku Kimin. Thank you.
Thank you. Welcome.
Salam sehat selalu.
Arigato, Prof. Wibi.
Ya, insyaallah. Ya.
Oh ya, salam hormat untuk beliau.
Ya, insyaallah. Ya.
Terima kasih panitia. Luar biasa.
Thank you all.
Salam.
Ini tim hore yang nggak tidur. Buat Ajan.
Ibu warnanya hijau, jadi
Dan Ajan, man behind the screen, come on. Aska. Aska.
nggak kelihatan. Green screen.
Bagus Kak, biar nggak tadi Kak. Sama yang tadi Kak, biar nggak Kak. Dirobas Kak.
Ini kita ngomong kayak
Kak, jangan dirobas Kak. Aska.
Thank you, Mrs. Mariati. Mrs. Mariati.
Foto dulu. Meja. Ayo.
Meja kau. Ini dicari.
Ayo.
Ya ibu nggak kelihatan. Ibu.
Lihat TV, jangan. Lihat kamera, jangan TV.
Iya.
Lihat kamera.
Kayak
Aska, this is man behind the screen.
Mau di sini. Siapa kelihatan? Alfon di sini.
Oke guys, live ya. Izin live. Izin live. Permission to live. Ke Ibu Dewi. To Mrs. Dewi, permission to live. Bye.
Be patient and kind. I'm not super, but I promise I'll try. When you feel pain and the darkness settles, I'll brave the rain. We'll fight through this battle, and I'll be here through thick and thin. You grow a little stronger, feel a little better, and time is slow. I can't control, but I promise you I'll give you mine. For me, what makes someone a hero is to empower and change their minds. I can promise that things will get better, but I promise for you I will.
Izin live.